Okay, I just want to make sure I can still access my notes.
Okay, sounds
So you
good.
took notes? You're going to blow me out of the water. I had no time to prepare for this one.
Okay.
What's going on, Soy Bill?
What's going on? Nice to meet you.
Nice to meet you. Hopefully, am I in frame okay?
You're
Yep,
holding
you
frame.
look
You're
fine.
mogging. You're frame maxing. You're gesture maxing. You look amazing.
Sorry.
Okay.
Sorry. I'm a fat fuck, so, I need to take up a lot of camera room.
So let's get this show started. I'm going to go off my starting screen and we'll just get things going. Both of you have been on my show before. You know how this goes. So we'll get this party started.
Okay.
Welcome, one and all, to yet another episode of WIC TV. It's a cross-ideological space where we come together, talk about issues both political and cultural, from the silly to the serious. Gang, have we got a show for you tonight? We're going to be talking about socialized healthcare. Is this the direction that we want to move forward in as a country? Is socialized healthcare better than the American system that we have? We're going to talk about it. We got some great guests today to discuss it. We have the Soy Pill, and then we have Tyler from the We're Offended podcast. And I want to start by giving the mic to Tyler to kind of open this up and give us his thoughts. So tell people who you are, what you do, why we should listen to you, and your opening thoughts on the matter, and then we'll get to Soy Pill. So go ahead, please.
Start with my opening statement here.
Hey, real quick, guys. Tell me if I'm using the right mic.
I would like to first thank WIC for graciously hosting this debate, and of course my opponent, the Soy Pill, for accepting the discussion. As stated, my name is Tyler, and I am the co-host of the best talk show you've never heard of, the We're Offended, You're Offended. So I am here to assert the false utopia that socialized healthcare is and the misconceptions associated with it. Socialized healthcare is a bureaucratic nightmare, mired in horror stories, ineffective care, and much closer associated with the death hospitals of Mother Teresa than anything that we would associate with the word healthcare. I will show that once a person becomes an expense line on a budget sheet, how utilitarian socialized healthcare truly is, how it benefits few while impacting many. My opponent, I assume, will talk about the number of Americans that have gone bankrupt from the healthcare costs, and I will show how wrong he is. He'll dance on the edge cases while I don't even need to contend with those, although I can. And I can even talk about the generalities. He'll make the emotional plea of, should someone have to think about dollars in such a vulnerable position? Is it compassionate to die while waiting to see a doctor?
This is
about chronic
crazy.
illness where the offered solution
I've
is
never had a healthcare
doctor-assisted
debate like
death?
this. He already knows everything I'm going to say.
My solution would include a hybrid system with a private option and a basic public option. A healthcare system that takes holistic approach, including dietary, exercise, and medicine as a last resort. If we view the experimentations of the little mustache man as evil, then socialized healthcare in Canada is no different. It is evil. And with that, I look forward to our discussion.
Okay, well, thank you for that. And I'm sure we will get into it as we go. Okay, Soy Pill.
Yeah, I'm
Go
not
ahead.
sure why I'm here. He seems to know all my arguments already, even though I've never really talked about it all that much. Socialized medicine, I think, is just a good thing in general. I don't think I necessarily hold the position that we need exclusively socialized medicine. I lived in Germany for quite a long time, and a hybrid system could and does work very well. If you just have to look at the analysis of all of the deficits in our country that come from our shitty healthcare, we pay more per person. Our life expectancy is not on par with any other Western country. I think we have the worst results out of any other, rich Western country, and I think that's unacceptable. I don't think that 27 million people should not be on insurance. I don't think that Obamacare is the acceptable, well, we did this so much and now we don't have to do anything more. I think any other system that is, bureaucratic could potentially be fine. It's going to have its shortcomings. You can look at Canada, you can look at Germany and say, wow, the wait times aren't so good, or I can't get a specialist as fast. That's why I do like the idea that in a hybrid system, if you really wanted to and you're rich, you could pay for more. No one's forcing you to be in the system. And in fact, you can opt out of the public system yourself if you live in that country. However, it's completely unacceptable that people are dying when they don't need to be dying. It is completely unacceptable. You can call it an emotional appeal, but it is unacceptable that people people do have to decide between money and living, and especially when it's a preventable disease, only because that disease, might cost a lot for the treatment. But unfortunately, there is rationing of care. This is always going to happen. There are some things that can't be cured without millions and millions of dollars, and we literally can't give that to everyone. And I understand that this is going to happen both in a private and a public system. The question is, can we get more people to live longer for cheaper? And the answer is yes, and that's why I think America should do it. That said, it's been a crazy week. I'm banned on Twitter, and so you're wrong in to say that I will cite bankrupting statistics, because I haven't looked at those, so I won't even cite them.
Okay. Well, again, there's unfortunate that you got banned on Twitter, but you're still allowed here on my show. Okay, the real free speech platform. With that, I'll open it up to discussion. If you guys start talking over each other or something, I'll mute you and we'll yell, and that'll happen. But with that, floor is yours, guys. Go ahead.
I'd actually want to start off and say, because I'm open-minded about this, right? Like, I understand not everything can work everywhere. I've listened to a lot of experts on this, and they say basically if you tried to copy paste any system from Norway, from Germany, from any South American system and put it into America, it would not work. Not to say that the concept of socialized medicine wouldn't work, but that you couldn't just one for one say, yep, just take all those policies, do them exactly the same here, and everything will be fine. You would have to tailor this in a certain way. So just in good faith, can you tell me why we should not have socialized medicine in America, period?
Yeah, so I would look at in terms of some of the misconceptions with regards to like bankruptcies. Of course, that's the big boogeyman with the United States is that millions of people go bankrupt, which is false. That number is significantly lower.
What's the misconception? Canada, just that they're overestimating it, or they're calculating it wrong?
Well, the kind of the general misconception is that millions of Americans die or don't get or can't afford health care, and they go bankrupt because of it. So even looking at the statistics in America, I think it's like of the bankruptcies that happen, it's like just going off dome piece, I think it's 0.1926% of bankruptcies that happen are because of medical expenses, while in Canada, where we have socialized healthcare, people actually go bankrupt. It's about 0.3% of the population. So in the United States, you guys have about 500,000 to low estimate, high estimate is 670,000 people go bankrupt from medical costs. While in Canada, if we attributed the same for per capita, with you guys having about 10 times our population, that would equate to about 1.3 million people going bankrupt from medical costs in Canada.
Okay, well, this is actually going to get into a really interesting discussion for me, where maybe you'll just be teaching me things, because one, I didn't know you were Canadian, and two, I was not aware that 1.3 million people in Canada do go bankrupt from medical costs. That's just a completely new fact to me. So my question to you is, how in a supposed socialized healthcare system are they able to go bankrupt if they're supposed to be paid for by taxes and subsidized by the government?
Right. So the extrapolation that I'm making, because the United States has about 10 times our population. So I think it's 137,000 Canadians a year go bankrupt from medical expenses.
Oh, I see what you're saying. So you changed it to a per capita. Okay, sure. But let's say the 170,000, how do they go bankrupt? Like, to what end are they able to spend money on healthcare that would otherwise be paid for by the government? Because my understanding is you in Canada do have socialized medicine, so...
Yes. Yeah. So a lot of that medication is not covered. You still have to, whatever, if it's a chronic issue that you end up becoming you have to take medication for basically the rest of your life, or at least until said condition is done. So that's where that 0.3% of the population actually runs into it, including, and I think the statistic is the same for the United States, that it's not just medical costs, but it's the associated impacts, whether it's loss of work, inability to continue working, or having meaningful employment. So we actually end up, it's more or less the same reasons in the United States and Canada. But again, and I think that's a fair, when you said, well, how could you with Canada having socialized healthcare? It's not so clear cut.
So then my next question, which would lead back to an argument or contention in this debate, is this not just an argument that, hey, we should also be subsidizing these drug costs so people aren't going bankrupt from chronic illnesses that require drugs, right?
Right, and we do. And in fact, you guys actually subsidize much of our prescription medication.
Is
So
this
that's,
the
I think that's
argument
one
about how
thing.
like our R&D departments pay so much? We pay a lot in cost for drug prices, or what do you mean by that?
Yes, yes. So that there's that, and our government has instituted price caps on medication, which, well, I guess some pharmaceutical CEO needs another hooker or another line of blow or something somewhere. So they're not going to pass the costs on to they're not going to absorb that cost. Of course, they're going to pass it on.
So I'm confused now because you said people are going. Maybe it's not the majority, but explain to me then, to what degree are these 170,000 people going bankrupt from Canadian healthcare costs, and also is subsidized? These drug costs are subsidized, or they're not completely paid for, but they're just capped. Is this what you're saying?
Yes, yes. So once you in addition to, so in our socialized healthcare, your physical care is covered. Anything after the hospital, that's on your dime. So even still, we would have to look at, say, something like Blue Cross, or I don't know what would be comparable in the United States, like a private insurance in order to cover it, and then it's tailored to whatever plan you could afford. So a family plan in Canada, you know, husband, wife, two kids, that could run anywhere from 300, say, even up to, say, 500 for a decent, which would include things like eye coverage, maybe an ambulance trip, and kind of those basic things,
Okay,
dental care.
I understand, but then let me loop this back to like the main kind of crux of the argument, because if the argument from here is, hey, there are still problems that can exist in a socialized healthcare state or something that's heavily subsidized by the government, I acknowledge this at the beginning. I completely agree. There are plenty of shortfalls like waiting times, quality of care, specialists, and as you said, yeah, if they don't cover everything, it would seem like maybe some people still go bankrupt, even in socialized countries. But to me, this would indicate that we should pay more for it. We should tax more and we should subsidize those things even further so that no one goes bankrupt. What is your reason then that we shouldn't do this?
Well, so in Canada, our healthcare is funded through general revenue, so it's collected through all taxes.
Hmm.
So, and in Canada, we spend about, the newest figure is about $19,000 per family, and I think comparatively, the United States pays about, I think it's expected to go about 25,000
Yeah, I thought it was around
for
30.
for
That sounds
for
right.
a family. Yeah, so I guess there is a bit of a, I think, for a solution, and why we should not fund more. I think because people actually don't take their healthcare seriously. I'm a living embodiment of it. I don't take my healthcare seriously. My doctor doesn't even take my healthcare seriously. So yeah, I
So
think
your prescription is why we shouldn't subsidize healthcare is because a projection of your care seriously. Like I'm not trying to be mean to you, but it's like, why is this a reason not to help everyone or at least attempt to, just because people don't take it seriously or some people don't? This doesn't make any sense to me.
right. I have no problem if someone that actually like needs care, like actually genuinely they go to a hospital and they need help.
Hmm.
And that compounds into many other issues that we could talk about with regards to wait times within Canada compared to the United States, the quality of care, the doctors that are actually being recruited. And so like this ends up becoming a big compounding issue, which I
Right.
agree with you. I think I would love to see, like I said, whether it be a hybrid system where everyone has access to it. And even I agree that, if someone wants to opt out, okay, great. I think that's a fantastic idea, and I would
Okay.
love to see movements for that. I think Alberta and I want to say Quebec have started exploring using private hospitals or private clinics in
Yeah.
order to deal with the backlog, with regards to wait time, and actually giving that kind of two-tiered system. So
Okay.
I agree. I agree with that. So I don't want to come across as though like, you should stand outside a hospital, and if
No,
anything happened, well, top shit, you're just, go to the wolves.
I
Okay.
guess just
Well,
a question on my end, real quick though, right?
Mhm.
Is maybe I misheard your opening, and you can correct me. But did you not call socialized healthcare like evil at the beginning of this
Yep.
debate? So if we want a system
half
that's
evil
two
and half
tiered,
not evil
yeah,
system.
yeah, half evil,
The
half
true
not evil. What's
centrist.
going on?
Yeah. Yeah. Right. Well, so if we want to talk about the potential pitfalls, I'm sure, well, this is actually starting to make waves in the United States with regards to MAID, or medical assistance in dying, which under compassionate grounds, the government could offer to kill you,
What's wrong with
to put it bluntly.
what's wrong with a legal avenue for suicide for people with chronic painful illnesses, and why would that be an argument against socialized healthcare? I mean, you could get that privately too, right?
Right, and I agree with it in theory. You know, I'm still kind of a liberal at heart, the compassionate line, but we have seen instances where people were given like what would the right word? Their documents weren't even correct, or they were ineligible, and doctors decided to do it anyway.
Okay.
So
I mean,
one
again, this
famous
sounds like
case
a
that happened.
mistake. We don't have to go into a specific case. I'm aware this could go wrong, and you could have bureaucratic fuck ups where you killed someone you weren't supposed to, in the same way that surgeons might cut off the wrong leg, and this is bad. But this is not, an inherent trait of socialized medicine. This is just a thing where people fucked up and they shouldn't do it. I agree. The criteria should be a lot stricter if we're going to be killing people. But again, if we're talking about whether or not we should have socialized medicine, I have yet to hear. Here's a big reason for me. If you look at all of the spending of all of the countries, and you look at how much more our spending is, you can literally draw a bar over every single socialized spending and the section of ours, Medicaid and Medicare, that is socialized, by the government, and it's almost on par with all of these other countries. The big giant gap that puts us at more expensive is the private industry. It seems to me that the private industry is what you described in your opening. It's bureaucratic, it's inefficient, it's not connected, because you got all these different systems and all these different hospitals and all these different insurers working not in tandem, but kind of against each other and competing and not sharing information. And it seems to me like this is more inefficient, both cost-wise and healthcare-wise. We don't have a longer life expectancy. We pay more. Why should I not be supporting something that seems to be working in lots of other places, to any degree? No, it doesn't have to be single payer. It doesn't have to be universal healthcare, Medicare for all. We abolish private insurance. But I mean, it just seems clearly that what we're doing is costing too much and not getting people to live longer. So what is your prescription then, if not to move to let's tax people more and put more money into a system that is more controlled and centralized?
I would probably look at more, as I had stated in my opening, that more of a holistic approach. Like I can give the anecdote that when I went to my doctor, and I was just saying like, yo, basically I'm a fat fuck, and he goes, "You want a pill for that?" Like, to me, that was actually kind of astounding. Like, hey, Tubby, are you exercising? What are you eating? Are you getting enough sleep? What kind of issues are you falling under? And so I think when we no longer become like an actual healthcare system, and it's just pushing pills, I think that there is a big problem with that.
Sure. I
So
mean, you can't have a pill for everything. That said, I mean, specifically for fat people, I think Ozempic is a fucking miracle drug, considering there's hardly any downsides. But even if we don't want to be paying to get skinnier, because I agree, there should be more personal responsibility and health education. All of this stuff is not to say that you can't have better healthcare and also be teaching people how to eat, how to diet, how to exercise, and promoting that more. But unfortunately, it seems to me in every single country where we try to say, hey, what if we just told people to be better? This just doesn't work as much as I want it to. If you look at, abstinence only education, hey, don't be dangerous, don't have sex, don't worry about the condom, because if you don't have sex, you'll never get a disease. Yeah, cool. Ideally, this would make everything better, but this never happens. People still do the things. People are still going to eat. People are going to be lazy. They're not going to work out. So do we look at the ideal world where everyone just does the right thing? Sure. The libertarian, what if markets controlled for everything works? But it doesn't work when we look at reality. So we have to have something to back up the fact that millions and millions of people don't have healthcare, that tens of thousands of people die because they don't go get preventable care that they should otherwise, maybe because of money. This is not the bankrupt statistic. This is just how many people are dying from it. And it's like, we can solve this. We can literally just say, hey, it does not cost you that money. And it's not going to be solved by going, hey, everyone just go work out. Oh, Michelle Obama tried it. RFK Jr. is going to try it, and they're not going to do it. Like, I wish they were, but they're not going to.
no, and I agree. And I think whether it is in terms of an incentive structure, um, it could be that there was a big propaganda push. What was it, in the 50s, I think, in the United States, that talked about like um, more having more kids. There was a whole national, I believe, campaign that was going along with that, or even like the adjusting people's eating, I guess, with even regards to like the food pyramid. But now that whole thing has gone away to a different what is it, like the plate, whatever,
Yeah.
the plate model or whatever they call it. Yeah. So I think having those kind of national campaigns in order to incentivize, whether it is like, hey, if you're healthy, you don't pay as much, let's say, for healthcare costs.
What does
Or
healthy mean?
What
By
does
the way,
healthy mean?
I want to explore this hypothetical because this is something that I would agree with on paper, but I think it's incredibly idealistic because you can't take into account because you mentioned edge cases at the beginning, but what we're talking about is not going to be edge cases. We're going to be talking about one, healthy, which is an almost impossible metric, right? Are you healthy as in you're skinny? Are you healthy as in you work out a lot? Are you healthy in terms of like whether or not you're prone to cancer or diabetes? Or are you one of the millions of Americans who are born with some pre-existing condition that just fucks you? And it's like, hey, did you get born with like, one leg? Well, guess what? Your healthcare just costs more inherently. Now it does already, but now we're going to also subsidize people who don't have that disadvantage and further widen that gap. That seems insane to me. As much as I'd like to say, yeah, I want to pay less taxes because I don't smoke like some idiot or because I go to the gym, that'd be cool. But it does not seem that this is going to work the way out for most people the way I want it to. It would just help, the people who are within the norm and also making good choices.
Right, and I think we have to kind of, I would say, maybe look at things in generalities and also in terms of like certain edge cases. Like if you are born with a deficiency, like sorry man, God just gave you a shitty hand and them's kind of the breaks.
Yeah, but why make that
Like
worse, right? It already is bad for them. Why then
no,
say, and also
I'm actually
you are
agreeing with you.
ineligible for healthcare subsidies, right?
No, in fact, I'm agreeing with you. So if someone's dealt like a shitty hand in life, I have no problem actually helping that person that needs it. Like
Okay.
someone that actually needs that assistance. I have no problem with that. I start getting a little leery when it's someone who literally just doesn't care, doesn't want to, and isn't interested in doing anything to actually, let's say, lessen the burden.
Yeah, but
So
to
so
to,
oh,
to
wait,
Soypil's question, just real quick, Soypil's question is asking you like, how do you define that? Where's the line? So, for example, if you had a guy like Asmongold who didn't brush his teeth, didn't take care of himself for years when he was a kid, and suddenly he wakes up and he's like, I gotta fix
why are you guys
myself.
all
I gotta
speaking
fix what
Spanish
I'm
in my
doing. I gotta
chat?
fix my life. Do they not get health care under your system, or how does that work?
No, I don't think that they be denied health care, but obviously that there would be some type of scale, much like in private, that they look at what conditions do you have? Do you smoke? Do you do X, Y, and Z? Do you have these things? Okay, well then it's kind of might cost you a little bit more because of the decisions that you're making.
Well, so here's the thing. How many people are doing this? Like, if you could show me an analysis that says, hey, in all these socialized healthcare nations, there are 20% of the people are taking advantage of it. They're completely lazy and they cost all this money. To then show that to me and say, and somehow they still pay less and have longer life expectancy, I'd say, I don't fucking care. I want a welfare system where half of people are just not working because they don't give a fuck. And it's like, yeah, that sucks. And I think these people have moral failings and should be better. But if it's working, then I don't care. I really don't. And yeah, it could be better. Yes, we could incentivize things. Maybe we could, get more programs out there, make, gym subsidies. I don't know. But like, ultimately, it doesn't seem to be the case that these people who are not taking care of themselves, because these exist in every country, are burdening the system so much that it breaks, right? Like, this is any welfare system is going to be taken advantage of. I used to support the concept of means testing welfare, like with drug tests, but ultimately, it seems to me that when you put this, lever of you can't have this money until you prove this thing to me, it just costs more money to check for that than it does to ignore the fact that some people are going to be lazy and not follow the rules. Again, you keep bringing up cases of things that I probably agree with, but ultimately when I press you on a prescription, you seem to agree with me that like, hey, maybe we should ultimately do this. It will be better for everyone. So do you even disagree that like more socialized healthcare would be better? Like, would you rather live in Canada than America right now? I'm a little confused as to like what you're actually against, or if you're just against the bad parts of socialized medicine, which I probably am too.
Well, I would probably say if I had a choice between Canada and the United States, it would probably be the United States.
Okay.
So,
And
um,
can you tell me why?
I think in terms of economic opportunity, the general cost of things are significantly cheaper in
Oh,
the
just
United
for
States
healthcare,
compared to
I thought it was
not
a
country.
relevant health.
Just for healthcare. Obviously, America is better. I'm
Oh,
not going to ever say that Canada is better than America, but just for healthcare. You got fucked in hockey.
For
We're gonna
healthcare,
fuck you in everything else now too. It's called soccer now, by the way.
ice soccer.
hmm
Um, for healthcare, I would agree that, or sorry, I shouldn't say that. I agree. I think the United States system for healthcare is effective because it builds in the inherent greed of people.
Uh,
And so because
yeah, go on. Sorry.
okay, so the reason why I'm saying that is Canada loses about 1,300 doctors to the United States a year.
Okay.
And only reason, well, why is, I think rightfully so, if someone takes out, several $100,000 in debt, they probably want to be compensated, as noble and charity driven these doctors might be. Well,
hmm
they took out significant burdens in order to do that.
Yep.
So I think with that built-in incentive structure, you need that. Like my own personal doctor, before she left, she's like, Canada healthcare sucks. Like, I literally make no money here. I'm actually poorer than someone being a manager at a grocery store. So what the hell am I doing? And
So,
this is a doctor.
yeah, let's address this one. I agree. Obviously, America is a brain drain in a lot of industries, not just doctors and
Mhm.
like all of science, because we do offer incredible incentive structures for highly educated people in careers with like PhDs and masters and doctorates. The problem is this brain drain doesn't help the average person. This helps people who have a lot of money and go to specialists. So doctors make a lot of money from people who have a lot of money and can pay for their like, crazy urologist who's like, yeah, I studied dicks for 20 years, right? But when I go to the general doctor, yeah, maybe they're paid more than they do in Canada, but I'm not getting really better care. I'm paying more. My insurance doesn't cover as much as I want, and I'm not living longer. I'm not getting the drugs that need me to like stay alive. Like I am lucky enough that I can pay out of pocket for some stuff that other people can't. And so I don't understand why, like maybe for you and for me, definitely, staying in America is better versus in Germany. Like the wait times for me for the stuff that I had to deal with, which was very non-life threatening, yeah, it kind of sucked because, they're saying, hey, I'm going to prioritize the guy whose like spleen is exploding versus you who has like a rash on their back. But that's not the case for most people. For most people, the brain drain from other countries doesn't really help them out. The general practitioners aren't 5,000 times better, even if they're getting paid a lot more. So, yeah, for you specifically, I guess the question is, do you think that American healthcare is better than Canadian healthcare, just in general, for the average person? You mentioned the bankruptcies, and that's a valid point, but is it really like the cost of it versus how long people are living and the quality of care? Is it really better? Like, do you have a maybe, like, I'm open to hearing an argument as to why it's not, but I don't really know any.
Yeah, so in fact, I think it was the Association of Nurse Practitioners. This is out of I believe this is out of Texas, and what they considered an unreasonable wait time to see a general practitioner, I believe, was 51 days, so about 2 months.
Okay,
In
that sounds
Canada,
reasonable.
the bare bones minimum, we've seen upwards of 49 weeks to see a doctor. I believe it's
This is
49.
this is the minimum to see a general practitioner.
That's the extreme. That's the worst case scenario, and I believe that was out of Newfoundland.
Okay,
I believe
so
it
in,
was a
in
20. I think it was
Newfoundland, some
49 weeks.
people are waiting like a year to see a GP, which yeah, that's awful. Okay, fair.
Yeah, and so and those wait times have only been getting worse. There's many stories. I believe since 2018, 100,000 people have died just waiting to see a doctor.
Okay,
And
see,
so you want
I,
to
I
talk
was
about
going I was going to
preventable.
contest that before, but that statistic really does matter to me. So I want to explore this. So maybe you know more than I do about this specific thing, and I do actually just want to ask: 100,000 people are dying because they are waiting. Are these people waiting in the same way like someone who's waiting for a kidney transplant is dying? Are they waiting to see a GP because they just want to check up? What is causing these deaths? And is it literally just, hey, if I got to see a doctor, this would be okay. However, I don't get to see a doctor because there's 60 people in front of me in a queue. Like, do you know more about that statistic?
Let me. I'll try and go off the dome piece a little bit, but I'll check
Hey,
my
I've been
notes.
off
But
the dome this whole time. You're good, man.
I think with regards to the 100,000, that is people that are just on wait lists. In addition to, I think it was 23,000 people have died waiting in ERs.
Okay. So
So
they
that
are
is
in need of immediate care and aren't getting it because they're impacted.
Yeah. And so,
okay. And do you just again, this isn't a gotcha. Do you have the comparison to America? Like, I know it's not going to be the same per capita is going to be different, but like, because again, wait times, like, as you're looking this up, I'm not trying to throw you off, but like, yes, wait times are bad. I don't like the idea that wait times get extended when you try to cover the. Yeah, go ahead. Sorry, do you have it?
Yeah, I did look it up.
Oh, thank you, Wick.
200,000 people die annually in U.S. emergency departments waiting on care.
Okay, right. So I guess this is actually to your point, not that, oh, haha, gotcha, ours is worse. Obviously, it's not worse per capita, but also it's like
terrible to per
capita.
Terrible.
Yeah, it's terrible. But it's also like, okay, but are these wait times? Is the cost of these wait times solved by socialized medicine? The answer is no. People are still dying. In fact, sometimes more people die from this, and that's bad. But does this outweigh the fact that more people are living longer, that we're spending less money? These are the trade-offs that I look for, and like, what system should we adopt? And so it's a valid point to say wait times are bad. That's why I said at the beginning, yeah, like, they're not perfect things. Wait times do fucking suck, and apparently they're lethal wait times for certain things. But does this now outweigh the cost of, hey, but everyone else has a higher life expectancy at 40, we're spending less money, more people have access to better care in general, and if they want, like I said, because you agreed to this, if people are dying and can afford not to, I don't want them to die anyway, obviously, like no one does, but I do like the option of, yeah, if you do have the money to, super pay out of an emergency, I think you should be able to. It sucks that poor people can't, but I don't think you should be limited by the government to say, sorry, we can't help you because then we'll have to help everyone. Did you bring enough socialized healthcare for the whole class? Like, that is dumb. But does this then say, oh, therefore we should keep the American system? I'm not quite sure about that.
Right, and that's why I think having a blended type of approach, whether it is, there is the public option, or even, hey, if you're Jeff Bezos and you need that sweet, sweet baby blood for whatever you're doing, okay, fine. Like, I wouldn't see a problem necessarily with someone that has the means to do it, in order to pay for it. And we are seeing improvements with regards to Alberta and and Quebec, where people are actually preferring, even though we still, through taxation, even though we still fund that, there are people that are willing to go above and beyond to, go to a private clinic.
So it seems that we're in agreement that a hybrid system would be better because at the very least we could both agree someone should have another option if they want it. Everyone shouldn't be forced to take the same thing. But then my question would be, if you view socialized healthcare as evil, why is it evil if more people, assuming this is true, maybe you have a number that shows this is not true, if more people are living longer and we're spending less, why is this bad?
I don't disagree that if people are living longer, but I think we have to look in terms of people's the quality of care that they're receiving. So I was looking at, I believe for the United States, you guys, I think it was between 80 and 90% of respondents said that they found their healthcare either satisfactory or good. While in Canada, I believe it was 67% of Canadians view our healthcare or the coverage or their care was actually unsatisfactory.
Okay.
I don't know to what degree I take this as valid.
I hate to interrupt because this is wild to me, and I just Soy Pill, is it the same on your chat? They can't speak English.
Everyone in my chat is speaking Spanish. I have no idea why.
English is blocked. It's blocking English messages in YouTube chat.
It's wait, what?
It's blocking super chats too.
Are you serious? Wait, hold on.
Wait, 20. You can super chat in Spanish, but not in English.
I just said test, unless test is a false cognate in Spanish.
Like, if you own the chat, it works. But like, I've had people send me stuff they're trying to say, it doesn't come out. Anyway, sorry. It's just.
Wait, what? Are you serious? Now someone's speaking
right now.
German.
It's blowing my mind.
This is like a flash mob thing, right? Like, this is
Everyone
a troll.
in my chat speaking Spanish right now because.
Well, I'm getting German. I'm getting Spanish. And I'm getting the number 67. So I don't know what to tell you. I mean, at least people can communicate some sort of ideas through symbols.
Yes. I don't know. I was just wondering, why is everyone speaking Spanish today? But okay.
I thought people were just fucking with you. I got Korean.
So too. Okay.
Okay, this already threw me off. What was I going to say? Can you remind me the last thing you said, Tyler? Oh, wait, hold on. Wait, I got
in
the hello. It's got to be a flash mob. I see a hello. Someone said hello. All right, that's not a false cognitive. Okay, go ahead.
Sorry, I made a mistake. The longest wait is in New Brunswick, and it's 60.9 weeks to see a general practitioner.
Yeah, okay. This didn't make a huge difference in the argument. But it's still bad, right? Yeah. But unfortunately, the longest wait to me matters a lot less to me than the... Well, the longest wait matters a lot less to me than the modal wait, the average wait, like whether or not they're dying while they're waiting, right? Which you did bring up, which is an important statistic. But just like, oh, this one guy waited a year. Like, I think I waited a year for one thing that I've ever done before, and it was shitty, but it was not life threatening. So the more important thing is who's dying. But remind me of what you were saying before, because I had a point, and then a bunch of people started speaking Spanish.
Oh, fuck, I don't know. I'm just going off. I'm going off the old brain.
Help us out.
Let me ask a super chat question that they gave me the money.
Is it in Spanish? I had spent a while.
It's in English. It's in English.
Oh.
Okay. My question is this.
Lástima.
Okay. Would either of you support programs to incentivize healthy living in a socialized system? Seems like there are a ton of ways to change behavior over time, i.e. tax credits, sin taxes on sugar, things like that. Thank you for the $20, Doobie. Appreciate it. Go ahead.
Yeah, we already do this. Go ahead.
Yeah. I don't agree with the idea of kind of sin taxes, because all those things do is it only impacts the people that are already impacted the most. And like it just in general, in terms of taxation, like just taxation in general, it impacts the people who already can't afford it already. So if they're kind of making, if all they can afford in their little food bodegas or whatever you guys have down there, if they can only afford is some sugary thing, well, they're going to go for it. But if there was, say, let's say, I don't know if it's for the United States, but there's actually no tax on, I believe it's non-prepared food. So like chips, or if you go to like the deli counter to grab a sandwich, but there's actually no tax on like vegetables or, things like that.
Yeah, I mean, I can also think of an example, maybe to your point. If you try to like, I support the concept. Again, this is an ideal thing, but not a thing I think works in practice, of taxing cigarettes out of existence. However, what ends up happening is people are already addicted to cigarettes. So poor people who already shouldn't be spending all the money they do on cigarettes are now buying more at a higher cost and just kind of fucking them over. And this does not, have the intended result, even though the impetus is there, and I agree with it. What really I think needs to happen for these sorts of things, you can have tax credits or subsidies for the gym, or you can have programs that promote healthy living, which again are somewhat effective, but not that much. I think you have to make it so these businesses are completely non-profitable. Like it's impossible to profit. So here's an example. It's not health-wise, but this is gambling. So I kind of like remember researching this recently. In California, it costs like $1 per hand to play at like a card room in a lot of places, because they've outlawed gambling against casinos, but they have this loophole where it says, well, instead we're going to have you bet against this card room banker, and you're just paying $1 to play the game, and you're technically playing against a private company, not the casino. It's a dumb thing to get around the California anti-gambling laws, and which if you look deeper into it, is actually also kind of supported by the tribal casinos who want to make more money. The point is, what ends up happening is you just lose more money if you're playing in these places. And so all the people that they're like, hey, gambling sucks all the poor people's money away. Well, it's like, okay, well, now you're making them lose even more because they've found a way around it and also spend the more money on that. And it's like, okay, what if we made it so that it costs way too much money? We're taxing you just to be a casino. So when you're not making 10% on every bet anymore. What if cigarettes, you're not taxing the cigarettes, so it's not at the point of sale, so people don't buy it. You're not, because the demand for an addictive substance is always going to be there. A demand for sugar is always going to be there. But what if you make it so that you have taxed now making the cigarettes, or taxed, done a VAT tax on all the materials that you need to buy it, or a property tax on like tobacco farms. I do think these things, like I agree with the concept of like kind of legislating or taxing sin out of existence, because these things are I don't think any legitimate business should need like a 12-step program to stop using their product. I think that's insane. Now alcohol is obviously the one that I think is probably impossible to get rid of, but I think for a lot of these we really can get rid of them, and we can also then promote healthy living through other things. All of this to say though, none of this is mutually exclusive with socialized medicine. I think this would help socialized medicine a whole lot, but I don't think this is the alternative that's going to fix American healthcare healthcare because, oh, now everyone will go work out and shit. Because even if I'm healthy, that doesn't mean I'm not going to get some weird appendix rupture that I might be worried if I can pay for or not. Yeah.
Right, and I think that's what we typically would associate with insurance is, the what ifs. Like not having health insurance, I think is insane to not have at least something. Like that's literally the reason why we have insurance on vehicles. Like it might not be you, but it could be someone else. But yeah, maybe you smoked one too many cigarettes and now you got fucking leukemia or something. I don't know.
Okay,
I don't know
but to
whatever
that end,
cigarettes.
then,
Okay.
like, do you think socialized medicine would then be the solution to getting 27 million people who are uninsured back onto some sort of insurance because they either can't afford it or don't know what to do? I don't know what the statistic is why they're not insured. I would assume most of them are worried about paying for insurance.
Well, so don't you guys already have like a national healthcare plan? Isn't that what Medicare or Medicaid or whatever isn't that already a socialized healthcare option?
Yeah, and I think it works
So then
pretty
why
well for the most part, but it doesn't work. It's not available to everyone. I mean, like, not if you make over a certain amount, these are pitfalls of this. For example, I don't qualify for Medicaid. I make too much money, and then
Right.
then I switched to YouTube, and now I do kind of qualify for parts of it, although my subsidies are going way up. It's not something that everyone has access to. The poorest of the poorest of the poor people almost definitely could just kind of get Medicaid for free. I mean, I know that for at the least exists in Medi-Cal for California. Like the poorest of the poor are going to be insured, but the 27 million people are not uninsured because they don't have, or like they have access to Medicaid and they don't care. It's because they don't have access to the cheap healthcare and they don't know how to pay for it. Maybe some portion of them are just uninformed and could figure it out through Medicaid, but it doesn't seem to be the case that that's why enough people are uninsured. God, everyone is speaking Spanish now. This is really distracting.
Hold on, just real quick. You can get around it if you type "o" at the end of every word. If you just put "o,"
Wait, is there like a
doesn't
legit
count.
what is this? Is YouTube implementing a law or something that's like
I don't
English
know,
is
but you
banned?
can't speak
This is a troll,
English.
Wick.
You have to
You're being
speak
flash
something
mobbed.
foreign. And $20
It's because
to
of the
Doobie to
cartels.
say soy pillow, goodo, Tylero, bado. Thank you for the $20. But yeah, that's all you have to do. Type O at the ever like El Faco Spanish O Workso. Okay.
Jesus
So
Christ.
just FYI. This is impacting me
Yeah.
financially, gang, because you can't.
Everyone's saying no hablo inglés and ayúdame. It's they're this is like maybe Trump was right. Maybe we need to deport all the immigrants. I don't know. It's
guess,
taken over.
I guess to at the end of the day, I guess I'm just struggling to understand why at least some form of socialized healthcare can't be a viable solution. Why is it evil? I guess.
Right. Yeah, and I think that's the big point of contention. As I said, do you guys think that the experiments that Dr. Mengele was doing on, do you think that was bad? I think I think
Yeah.
I'm kind of rhetorical.
Yeah, it's a little absurd, but yeah, I think most of them were bad. Although, hey, I think we got some data out of some of them, or maybe I'm confusing it because there's the Japanese, what was it, 731, and it was like, hey, it turns out if you fucking microwave a guy, he dies, and it's like, great, cool, this is useless information. So, yeah,
join bodies together like twins together to see what they do. Like, yeah, it's really disgusting that medical those experiments happen. And the reason why I say that if we view that as evil, then in the ultimate form of compassion, if someone is saying, I need help, I don't want to die, I need help, and the solution is, well, how about we just kill you instead? That's not healthcare.
Oh, okay. So you're talking about MAID again, but again, this isn't a socialized healthcare is evil. This is MAID is evil, which is an argument, but that has nothing to do with whether or not we should have socialized healthcare. Because a private company could do the same thing, right?
Yeah, I suppose they could, but why I'm saying this socialized aspect of it. So during at the start of COVID, our Canadian government commissioned a study. How much is a human worth?
Okay. All right.
And the number they came back with was about $60,000. That's how much it costs to keep someone alive.
Okay.
So once you start costing more than what you're valued, the government starts pushing people down that road.
So
and so
okay,
that's
wait,
why
I see kind of what you're saying. You're saying if the government analyzes in a socialized system that you're costing the system more than it's worth to keep you alive and a functioning member and a tax-paying member of society, they will start now being incentivized to push you toward killing yourself with healthcare. This is the
Yeah.
end product of the more socialized. Okay, if this is the case, why does this just, first of all, does not exist in most countries who have had socialized medicine for upwards of centuries? And two, even if it does exist in those countries, what percentage of people are being pushed into this? Is it like dozens of people? Is it more than 1%? Or like, I thought MAID was almost exclusively reserved for people with chronic illnesses who can't be cured, who are in constant pain. Not, maybe it would cost too much to operate on your appendix, so fucking why don't you kill yourself, buddy? You know, like, is that really what's happening in Canada, and to what degree?
Yeah, so there were a couple stories that had come out. It was a former Olympian, and she ended up needing a lift chair to go from the main floor up to the second floor of her house.
Yeah, I'd kill
And-
myself. No, go
Yeah,
ahead.
I know, me too. I didn't get like this by walking stairs, guys. Let's be real. But so the government said, no, we're not going to fund your lift or your mobility chair to go upstairs. How about we kill you instead? And there are
Okay.
many stories like that. We've had, Army like veterans that have come back, and it became a big story here that instead of them actually seeking the assistance that they needed, they were just told, well, how about you kill yourself instead?
So, okay, obviously this is bad. The reason I asked at the forefront was I'm not denying the claim that this has happened before, or that there are even maybe dozens of stories. That's why I said dozens. What percentage of people is this happening? Is it becoming more common? Yeah, obviously I think you're going to get more cases of this if MAID exists. But like, to what degree is this an actual issue with socialized medicine where they have MAID? And to what degree is it, hey, I'm blowing up every single story, because this is what my opinion on this is. I see every single story about this blown up on my feed and every single social media app, because the people who bring it up are like, and this is why we shouldn't have socialized healthcare, because they just want to kill you when you cost too much. And also just one final point. This is comparing it to America, where we say, oh, you can't afford this, or you cost us too much. Well, don't go, we won't kill you, but you're just going to go die. Bye. Right? Like, so they just kind of offset the death part to someone else instead of paying for it, which is more cost effective. I'll admit that, if we're not paying for it, but it's not really better.
Right. No, and so in Canada, MAID is I believe the number 5 killer in Canada.
The 5th most deaths in Canada is from MAID?
Yeah.
I am so incredulous of this. Wick, can we fact check? I'm not saying I don't believe like I'm sure you've seen this before, but that sounds insane to me. Maybe you're right, but holy shit.
So where this gets hidden, so this is all unofficial numbers, because they will never say that won't. Well, no. So I'll explain why. So they don't say on the death certificate.
Just real quick, according to the Denison Forum, euthanasia is now the 5th leading cause of death in Canada. That is true.
What's the Denison Forum? I'm questioning the source now.
I
can't believe
it.
it.
4.7% to 5.1% of all deaths, with over 15,000 cases recorded, marking a significant rise since its legalization in 2016, and placing it behind major causes like cancer and heart disease. It's not just that site. There's a few others that are saying.
Jesus Christ. Okay, so 5% of all deaths in Canada are euthanasia?
The number 5 killer. What was the percentage, Wick? Sorry.
4.7 to 5.1% of all deaths.
And so with that number, so on your death certificate, it won't say, "Oh, doctor shot you up with a needle." They'll give the underlying condition. So one story that had come out was someone had seasonal depression and type 1 diabetes. So what it'll say on his death certificate is that he died from diabetes. It won't say that he died from MAID.
Okay, $10.
So wait, there's a. Okay, go ahead. Well,
$10 from Doobie. Discordo Pleaso, and on Discord he asked me, how much does Tyler think a private insurance company should be forced to spend to keep an 80-year-old alive? Seems like we need to draw the line somewhere. If 60,000 is too low, what's too high?
No, I don't. I don't think you do. And actually, the fact that person brings that up, that's exactly what happened during COVID, especially in Italy. That's what they did. So when an old person, and I think you guys know, like Italy has a very multi-generational home, like grandparents, parents, children, grandchildren, all live in one home. So what, I can't remember the cutoff number that they had, but let's just say it's 65 or whatever. Let's say 70. Okay. Basically, they just turned around and said, okay, you know what? You're not getting any treatment in the hospital. Just go home. So what number is it? I would say what the person can afford. And I think when you look at, like I said, with regards to what Italy did during COVID, we got to see the utilitarian socialized healthcare in full swing. They just said, even though you paid into the system, yeah, go home and just die. We're not going to take care of you. We had in Quebec that if someone was unvaccinated because they had whatever reason they couldn't, the Quebec government wanted to institute a unvaccinated tax. So even though you already pay for a service, they wanted to charge you a tax on top of because you didn't get the jibby jab.
Isn't this something you want? Right? This is a government incentive to make you healthier.
Incentive would be not taxing someone for a service they already paid for. Yeah, like that's the whole kind of premise of paying into a socialized healthcare, is that when you need it, you paid into that system.
You were talking about, though, potentially taxing cigarettes or sugar or something like this. Why is this, or charging people less because they're healthier? And what is the functional difference between saying you need to pay more because you're not healthy, or, hey, I'm taxing you more because you didn't get something that would have made you healthier? Wouldn't this be kind of what you want?
Well, no, I actually argued against putting sin taxes because it already impacts the people that can't afford it already.
That's true.
That's who it already disproportionately impacts. So I think to all of a sudden put a, hey, if you don't, remember like Jimmy Kimmel said, well, you know, if you don't get vaccinated, you go to the back of the line and here you go wheezy and whatever. Like you can go stand outside, but if you got the jibby jab, right this way, sir. Like that sounds like the most callous and careless thing for someone that made a decision, especially with regards to, well, we don't have to get into the ideas of COVID, but
well, do you not think that there should be disincentives to do things that could endanger public health when you're entering a medical system? At the very least, say, hey, maybe it can't be so simple as, oh, you didn't get the vaccine, you're at the back of the line for a kidney, but hey, if you didn't get the vaccine, we're going to take extra precautions and do this whole bureaucratic mess so that you don't potentially infect and kill people when you come in here because you're not vaccinated, right?
Well, we've literally had that happen here.
No, I'm asking why it doesn't make sense.
Right. Why it doesn't make sense? Yeah. I think that if you are paying for a service, you should be rendered that service, not arbitrarily throwing in something just in order for compliance sake.
Okay, so let's say I have this is a silly analogy. Let's say I have a gym membership, and before I walk into this gym that I pay for, I've got blood on my t-shirt and a knife with blood all over it, and I'm kind of just like vaguely like jabbing around in an area around me, and they're like, hey, we're gonna keep an extra eye on you. Yeah, so that you don't fucking stab anyone while you're in here. I'm like, well, I don't want to stab anyone, but you know, it could happen if I get close. Don't you think that maybe just because I paid for it, there's still some now external factors that affect the fact that I could harm other people in the area I'm entering, and I'm not entitled to harm other people?
I think with regards to with COVID, like, I don't know, if we really want to go down this path, we can, but I think when you are now compelling people on an additional, it would be like if you, I don't know, you paid someone to drywall your house or something, and then once they get to the job, it's like, oh, well, if you actually want us to do it, it's giving you another $200. But we're going to keep your deposit and the money and everything else that we took from you. We're just not going to give you that service.
Yeah, but to make it analogous, it's because every time they try to do the drywall, there's like a 30% chance I'm going to go over and just kick over the work they've done so far. And they're like, hey, what the fuck? you're endangering us in our job, and you're making it harder. We're gonna charge you a little more if you're gonna keep doing this shit, right? Like, it's not just you paid for a service and now we're taxing you more. It's, hey, you have now made a choice that will actively endanger both the medical personnel and other people who don't get to decide whether or not you give them COVID. So we're going to do something about that and say, hey, let's just incentivize this because you could harm other people. And I think that's completely legitimate.
That's legitimate if you already paid for that service.
Yeah, absolutely.
So you would just deny. So then that would actually violate our charter, and I believe that would actually violate your guys' constitution.
Wait, what?
I don't know if you guys actually have a provision specifically that says about accessing healthcare. Everyone has a right to access healthcare.
I didn't say they shouldn't be able to access the healthcare. I said we should disincentivize it, right? I'm not saying don't treat unvaccinated people. Like, if you're unvaccinated, you got in a car crash and you're bleeding to death, and they're like, well, he doesn't have his vaccine card, let him bleed out. Yeah, that's insane. But if it's, hey, I want to go to get care at the hospital, and they're like, cool, we're asking that you get vaccinated so you don't spread COVID around to all those patients, and you say no. Or it's like, all right, well, we can't not treat you, but we're going to make sure that you're incentivized not to do what you're doing right now, since we, one, can't force you to get the jab, and two, not give you the care, right?
Right. Well, and I think of maybe my position just with regards to COVID. It's that actually went a lot deeper than I think. Just it was healthcare, or people were dropping like flies.
I get, and I'm sorry, I'm a little distracted, but maybe you guys covered this question, maybe you didn't. Tyler, to your point about not wanting to not wanting to treat unvaccinated people differently than you would treat vaccinated people. Earlier in this argument, you made an argument that you would treat someone who has chosen to be unhealthy differently in your healthcare system than someone who was healthy. You would charge them a different rate. How is this different?
I think once your terms and conditions of your contract, I think if you sign that contract saying, okay, I will pay this for this, and that's kind of the end of it, fine. But if I retroactively decide, or just in this moment, I decide, well, you know what, because I want you to comply, I'm going to arbitrarily add this additional thing.
Well, it's not arbitrary. It was a national emergency and an unprecedented pandemic. And again, if you already paid for the healthcare, I mean, we can make a one-to-one analogy, right? Like, do you think that if you go to get treated and you're stabbing people in the hospital, or you're threatening to, and you're not like 100% likely to, that they should be like, well, I know you already paid for this, but you in some ways, by causing damage to other people, are breaking the contract. So we're now adding a stipulation that says, if you're going to break this contract in such a way that might hurt other people that you kind of, implicitly by the societal rule said you weren't going to do, then we're going to make sure we can do everything in our power to stop you without not giving you the healthcare. And also, just to be clear, this does disproportionately affect the poor people, just like your anti-syntax thing, where like, hey, let's incentivize people to be healthier. It's going to be like, hey, well, who's more likely to be less healthy and obese? It's people who are poor, who are uneducated about diet, who don't have access to gyms, who don't have time to work out, who don't have time to cook better food. Like, all of these things are going to have the same arguments that you gave against them if we're trying to incentivize their healthy behavior. But that's two separate things. So sorry for good scalloping.
Yeah, no, and I like I said, I think my own kind of, maybe not my personal gripe with the response to COVID, maybe that puts me in a certain level of bias, but I'm more in kind of general speak. I think that even in still looking at how socialized healthcare decided that if you don't, then we're just not going to take care of you. I think that's like a fundamental problem. Like, what if the person just, hey, you know what? I'm going to go somewhere where they actually take care of me, and I'm not forced into a system that would do this type of thing. Like I said, maybe it's just my COVID bias in that particular topic, but I don't know. Maybe I'm logically inconsistent on this, which I'm totally fine with.
Well, well, if that case, I do really want to quickly address one other point we moved past, which is the MAID thing. Now, I haven't had a lot of time to look into this, but is the reason, because I could not believe it, let's assume this is true, 5% of people are dying from MAID. So there were kind of two things here. One, you said, well, look at this statistic. It's hugely inflated. 5% of people are dying, but also they're not putting it as the cause of death. So is the implication between that first point that even more people than the 5% are dying and they're just not reporting it? Okay, cool. So let's just assume this is true because I haven't looked into it. Sure. So if this is true, I'd want to see to what degree, because we have these stories of people who are like, oh, you've got chronic diabetes and depression, kill yourself. Yeah, that's awful. But how many of these people are people that would have died within the next few months because of a terminal illness? That, like, oh, the MAID is going way, way, way up because all these people who have stage 4 cancer are saying, I want to die with dignity. Give me the, like oxygen deprivation chamber so that I don't fucking have all my hair fall out and die a painful, horrible death on my deathbed. And how many of them are, hey, you might die from this. We're not really sure. We'll just kill you. I think the best possible argument against this for me is, all right, MAID shouldn't be an option because the shortfalls and the mistakes are going to kill an unnecessary amount of people in the same way I might be against the death penalty. But I'm not quite sure that just because they have socialized healthcare and they've introduced MAID, that this is now causing like a bunch of people who otherwise would not have died to die because they're doing MAID. Do you have like a breakdown of that number?
I don't, and that's where reporting on this. So the Canadian government, I think, our numbers are normally about 3 years behind in with a lot of statistics, and a lot of their statistics they just they're not very good. They're not very good of actually breaking down those numbers.
So again, this is in good faith. Why do you believe it's that high?
Because
just to be clear, let me clarify my question. The reason I don't is because I don't have any reason to believe that the government is just arbitrarily like killing people they shouldn't. I do believe that most people wouldn't choose to do this. Well, hold on, let me finish, because I understand your argument of like how much they cost, right? I understand the idea that there is some degree or incentive of people kind of pushing towards this because it's like, I don't want to pay for their healthcare anymore and it's socialized, but I don't have reason to believe that this is the majority of the case. It's hey, this might happen sometimes and that's bad, but that's not what's the overall outcome of MAID is or socialized medicine. So why do you believe not that? If these numbers can't be broken down because of bad reporting.
Right. And only thing that I could really answer is I don't know. And that's because I don't think we really know those numbers because they are obfuscated. So if it is just that number 5, maybe it is. And I agree that, I think we agree on the, if someone, they know that they're not, like, their ticket's punched, they're just waiting for the train to get here.
Yeah.
Like they're not making it out of it. And yeah, as someone that watched, like, my mother die from Lou Gehrig's disease, or my grandmother die from Lou Gehrig's disease, I wish she had that option rather than pumping her full of morphine and shutting the machines off and watching her choke to death. I would much rather that she was able to die at least with her faculties. Well, that's the shitty thing actually with Lou Gehrig's. Your brain still works, but your body shuts down. So I don't
want to be insensitive because I'm really sorry this happened to you, but what you described, isn't that better? Like, I thought getting hopped up on morphine is good, if I'm not, like, am I crazy? I'm totally uninformed about this. I would assume a slow, like, CO2 pumped into a thing, so you just kind of like slowly like go to sleep, wouldn't be as good as being pumped full of like the drug that people steal to get high, right? Am I crazy, or like am I just completely uninformed about this?
I've never had that happen, so I don't know, but I do have a question for you, Soy Pill, on the
okay, moving on. All right.
Right. I'm
sorry.
how do you want to answer? Like, I don't know.
Well, no. I was asking because he said like that was horrible. And don't get me wrong, like losing a loved one like that is horrible, and I'm trying not to be insensitive about this. But like, getting pumped full of morphine and turning the machine off, is that not like it's supposed to be like we've given you kind of like a big nice high, so you go to sleep and like the drug OD kind of thing, or am I crazy?
Right. No, and I understand where you're coming from, and I'm not looking at it as incentive or as being insensitive, because it was finally after she, her body just stopped working, her muscles had atrophied to the point that it just didn't work. Then, after finally, like I believe it was actually like my dad or my aunt had to beg the nurses, what can we do to stop her suffering, because this is terrible to see.
Understood. Right. So
Yeah,
she was in a lot
yeah.
of pain at the end, and this was like the kind of the Hail Mary kind of. I understand now. Sorry, and I wasn't
Yeah,
smiling
yeah.
at your story again. So now people are posting
No, it's-
Chinese and JJ McCullough, who famous Canadian YouTuber, is now throwing some weird crap in there. It's really distracting and tonally
I
whiplashing me
apologize,
from
gang.
the sorrow of your story. I apologize for that. But
It's just amazing how bad YouTube is right now. I don't know why, but it's affecting my financially since people can't super chat, and I am very angry about that.
well, they can super
I
chat.
guess
It's not in English.
yeah, but they gotta do it in Spanish or something. Like this guy, $5. But I don't know what this says. In my listening library for $5 says, "Cuánto tiempo debemos sufrir antes de obtener más contenido bueno, señor Wick TV?" Did I just
how much?
I don't know.
How much should we suffer before we gain more? I didn't hear the last one. More money? I didn't hear the last one.
Yeah. Whatever. The question I have for you though, Soy Pill, right? When it comes to medical assistance and death,
Mm-hmm.
I understand that there are reports of people who have been offered maids or given maids that for like having seasonal depression, diabetes, and you say that these are one-offs, these are outliers, these are not a reason to
I'm not.
attack
Well, let me
the system
be
itself.
clear. I'm not saying these are one-offs. I'm saying it seems to me they're one-offs, and that's why I asked if you could show me that this was like a good chunk of the cases. That would be an argument against MAID, because just this existing is going to cause enough, unnecessary death that I would not support it. In the same way, the amount of unnecessary death and unjust death from the death penalty causes me to not support it, even though in principle I support the cause of some people just deserve to die, I think, in certain cases. However, it does not seem to be the case that we can legislate this in such a way that does not cause innocent people to die in a way that I'm okay with. I would not be okay with MAID existing, even though, like Tyler said, he might have wanted MAID for his grandmother, but this is not something he sees as a good incentive. And if you could show me that a good chunk of these people should not be getting MAID, then I would say, maybe I don't support MAID. But that's not a socialized healthcare thing. The only way it ties back to socialized healthcare is if what Tyler said is the reason they're doing it is because we have socialized healthcare, and the healthcare is like a costly thing and it's zero sum, and so they're pushing more people to save money, yeah. Right. And so I would have to see an extensive study of all of these numbers, and it's like, yep, turns out people are just like pushing people into suicide because they don't want to pay for them. And even then, even if that was true, it would still have to be worse than just people not getting healthcare because it's too expensive in America, right? So, as bad as that would be, it might even be better than what we have. So, yeah, all that.
How many would you allow, out of curiosity, right? If it was only like 5% of the people who got maids, so 5% of the 5%, that they didn't actually need maids, but because of financial incentives, the doctors offered it to them and kind of led them down that primrose path.
I'd say that'd be too many. 5% is probably too many. For MAID, I would say it would have to be like, I don't remember what the death penalty numbers are. It's been a while since I did the research, but the death penalty was like a really good chunk. It was like 1/8 or something, where proven innocent afterwards or while they're on death row. I'd have to go look it up. But if we were getting like a couple edge cases here and there where it's like a few dozen of the like tens of thousands, hundreds of thousands, like far less than 1% are accidentally pushed into this, I'd be like, yeah, this isn't good. One death is too many, but ultimately this helps so many people from suffering that I think we should work out the kinks and have a better system and fix it rather than get rid of it altogether. But if it was a good chunk, if it was like more than 1-2%, and it's like, hey, we're just like telling people who are sad to kill themselves, which is like, it's against TOS for a reason, because a lot of them do. I would say we probably shouldn't have it existing as a method or an option, which sucks for some people, but it clearly has too many unintended consequences. In the same way, if it wasn't working in welfare has probably a much higher failure rate for people that shouldn't be getting welfare and are getting welfare, right? But people getting welfare isn't killing people, so it's a different litmus test. When it's death, there should be a much stricter regimen.
Yeah, and that was actually a big concern. Oh, was it out of Switzerland, I think, which they've had a version of MAID. I can't remember which year, but it's been around significantly longer than we've had in Canada. And I think their number is about 1% of deaths come from their MAID program.
But 1% of
Well,
deaths,
like I
not
said,
1% of people that don't have fatal diseases deaths, right? If 1%, or if if what was it in Canada? You said it's the fifth highest, 5%. If almost all of these, I think someone posted this in chat. I don't know if it's true. If it's 96% of these people are people that reasonably were about to die. This is better. It's still 4% of people who aren't reasonably about to die, which is like, all right, I still think that's too high. But that's different from 1% of people are dying from this. It's how many of these people are taking this as a good alternative to dying a undignified, painful, slow, my body deteriorates death. That's what I'd be worried about.
Right, and I
now we're Jar Jar Binksing in chat. This is great. Okay, well, very serious topic about death, and everyone's like, "Wisa Gunga die soon."
Yeah, if you type "O" at the end of every word, it works. So my chat looks names work. Names work too, like Laken Riley. You can say that. I don't know what that's in reference to, but someone's put it in the chat. So
Laken Riley's the woman who was killed by an illegal immigrant.
I know who she is, but I don't know how how does this apply?
They're getting back because they said the Mexicans, because they said it was an illegal that killed her. That they're getting them back.
I would guess that maybe that's like should we let so many people in if people like Laken Riley die, and it's like, hey, should we have made if people who shouldn't die do die? And the answer is, well, depends on how much unintended death happens. And I think if it was just Laken Riley, I'd be a lot more okay with it. If it was 5% of Americans are being killed because of illegal immigration, I'd say, wow, we really need to crack down on this way harder. Luckily, we're not even close to that, and it's usually scaremongering. So,
well, and I don't think that we want to get into like the kind of threshold. Was it like a threshold fallacy? Like, okay, I guess there is some level of like there's going to be an error, but how much? How much error? It's either if your idea of like the death penalty, that okay, in theory, yes, there's some people that deserve the wood chipper, but would you trust the government to actually do it, like actually have a to get it right? Would they actually get it right 100% of the time? And because of that, 5% XCOM, you always get some variance of wrong. Well, is that not a problem in itself?
It is, but the problem, especially when we're talking about healthcare, there is no 100% system. So you're always going to say, what's getting fewer people killed? If MAID is a hard one because you're comparing it to no one has MAID versus they have MAID and a bunch of people are dying, but to what degree are there like a couple people that are getting it when they shouldn't? Or if it's a huge chunk of them, and if you could prove that it's like a significant chunk, and like I said, my threshold's pretty low. If it was like 1-2% of people who are on this shouldn't be getting it, I'd be like, we need to reevaluate the way this is incentivized. But if we're talking about just healthcare in general, and it's like, all right, well, not 100% of people are dying, or hey, hundreds of thousands of people in Canada are dying because of wait times. It's like, oh shit, that's horrible. But wait, how many dying in America? Okay, not as many, but a lot. How many people are uninsured? Okay, a lot. Now we have to compare who's suffering more, who's living not as long. Right, exactly. And that's kind of, it's a threshold argument, but yeah, it's a bad threshold versus a worse threshold, and I'm going to pick the less bad one. It seems to me that socialized healthcare is less bad.
Yeah, well, and that's why I made the association of like it's basically like the death hospitals of Mother Teresa. It's I can give my own anecdotes. I've talked about people. I think people's satisfaction. I think that's a big indicator of where people actually, if they actually find their healthcare good. Like I said, it was like 67% of Canadians find their healthcare unsatisfactory, while
I wanted to
Americans,
address that
I believe,
too.
80 and 90.
I as much as I don't like dismissing this sort of like data, but my problem with that is who's being asked. This isn't the case necessarily, but if more people were dying here, a lot fewer of them are going to say I'm satisfied because they're dead. If Canada has a higher standard, right? Like if the standards of what I expect from the government are higher, then it doesn't really matter if they're only 67% satisfied. If they're not satisfied because, we're all living longer and it's better and everyone's costing less, but I want my doctor to be nicer. I want the wait time to be shorter, right? Like it depends on why they're answering these things. And so just asking you if you're satisfied or not isn't enough because I don't know what they're comparing it to. I don't know if the conditions are the same, and I don't know what the metric for like satisfactory is. It's a quality that's not really quantifiable. I have a request. I don't know. I mentioned I invoked JJ before. He has a question for you, especially in considering to this MAID thing, where it's like, oh, they're trying to save money, so they're having people get killed more. He says, if you think the Canadian government is actually concerned with saving money, considering they haven't had a balanced budget in ages, what is your evidence for this fiscal responsibility incentive on the part of the Liberal government? So why? Like, don't get me wrong. In concept, it makes sense. Hey, if they wanted to save money, they might drive more people to this MAID thing. Is there any evidence to this, or is it just it makes sense that this could happen? Because if there's not really evidence beyond that, it just seems like it's a conspiracy that could be true but has nothing to back it up.
Well, I know isn't actually like JJ.
It's
or is it
JJ
just like a
McCullough.
troll?
No, JJ is texting me. Me and him are friends.
An imposter. Okay.
Oh.
He was in my chat too,
Okay.
speaking like Russian or something.
Yeah. So I would look at how the Liberal government has, especially under Mark Carney, has actually taken a real like hard line stance in trying to reduce costs, like government costs and overall kind of budget costs, even though we run another $86 billion deficit. I know that's like fucking piss in the ocean for you guys, but when our GDP is 3.2, I think it's 3.2 trillion. No, 2.4. I think it's 2.4 trillion. Compared to your 38 trillion. Yeah, 86 billion is a lot. But to answer JJ's question, I think because the government has been taking that hardline stance, and I think because of the ballooning costs that we have been seeing with healthcare, I think it's like 24% of collected taxes goes into healthcare. And I have a couple speculations as to why they might want to kind of cut that number down. We are importing significantly more people. So that could be a concern that people are bringing in their elder parents that would need to access these types of things. I don't know necessarily the exact reason as to why that was coming out. Maybe it was an austerity thing because with regards to COVID.
Well,
Yeah,
then I almost cut off and say, well, no, yeah, it seems we have an answer, and this is not. I'm not trying to disparage you too much, but right now it is just a theory that is plausible because it does make sense. This would save on costs, but is not backed up by some sort of higher level analysis. So if this came out in a big report in 5 years, you would be 100% vindicated because it's like, yeah, we suspected this could be a way that they were trying to save money. Possibly, but I wouldn't say that this is an argument against socialized healthcare, only that, one, if it's happening, that MAID is a bad incentive, and two, if it's not happening or we don't know, we should look into it more to make sure people aren't being, subconsciously or manufactured consent pushing people into doing it. But it reminds me of people saying, don't sign up to be an organ donor because then they won't save you on the operating table because they want your organs. Like, maybe this could happen, but I have yet to see a bunch of organ donors being harvested and like killing them on purpose. Like there's like some big whistleblower comes out and nurses and surgeons are like, yeah, well, they told me not to finish him off, like, not to do the surgery on him because I could just take his organ. Like, this is not happening en masse.
Well, and this is, I know you're kind of joking about it, but Canada has become one of the leading organ selling markets or suppliers in the world. Actually, I believe we're now surpassing China.
Okay.
So,
but
I don't know.
That statistic alone doesn't tell me they're trying to let people die to get their organs. It just means, what was it?
Hold on.
First of all,
is it? Pill. He's saying that they're importing people, elderly people, so that they can give them maids, harvest their organs, and sell them on the black market. It makes
total sense. Wait, are you actually saying that? Or
yeah,
that's why they have open borders. That's why they have
open
borders.
No, that's not what I'm saying.
Absolutely true.
That's not what I'm saying.
Well, that's a nationalistic argument, Wick. I'd be like, all right, as long as you're not taking our American organs, take those immigrant organs.
Yeah.
Real quick, JJ is using me as a proxy. To be clear, he has said, well, the current government is bragging about increasing funding to healthcare. So they're talking about, like, as a public policy good, they are increasing healthcare spending. So how would you square that circle with, and actually they're doing this to save money?
Well, and as I said, I don't know if with that study being commissioned, if it was like an austerity thing during COVID, that that they kind of maybe put a hard line, this $60,000 hard line stance.
Well,
I know our government is looking at importing more doctors.
Did the study have anything to do with MAID, or was just, hey, let's analyze how much per person we're spending, which is a
No,
good metric to have?
I don't believe the study was related to me, but it was with regards to healthcare costs. Maybe I'm
Yeah.
misremembering, but I don't think it was directly tied to MAID. It wasn't
My
like
guess would be, and I don't know
because
where
of
you.
$60,000.
Yeah, like
No, go ahead.
if they were killing people with MAID because they wanted to save on healthcare, it would make sense that you would want to make sure you know what the threshold is to kill those people, and in terms of how much it's costing you. But these are not, conclusive at all. It's just, hey, the government wants to know how much they're spending per person. Maybe they're looking at ways to improve this, and also MAID is a thing at the same time. We would have to connect a lot of things, and it seems that at the same time they're bragging about increasing the funding. So this would be very spurious to me unless we did some top level analysis and said, well, hold on, turns out a bunch of people who are coming out and saying, yeah, I'm making certain decisions to save on cost, or I promote MAID when I think this person has a less than X amount of dollars chance of living, like that. If you could show that, but it seems like right now it's just a theory. I'm not saying it's impossible, but you'd have to really show a lot for this to be like definitely, and this is why we need to oppose not just MAID but also socialized medicine, and especially the two in tandem.
Right. Well, and I don't know, how conspiratorial do you want to get?
I mean, for fun, we can go as much as you want,
but
as long as we're acknowledging it's a very, very, conspiracy-brained argument against something in the same way, like, oh, I won't get the jab because it's got a microchip in it. It's like, hey, maybe, but I'm not gonna, what percentage true do I think this is possible?
Speaking of conspiracies, just real quick, if you're in my chat, because some of you can type English now, but some of you can't. I'm wondering if you reload, can you type English? Someone try it. Anyway, because a couple people are able to speak English, and almost no one else is. And
I'm convinced this is like a flash mob that people
please.
planned a week ahead of time, but
for just everyone across all chats on YouTube.
No, you could do it on two chats.
If it was Punjabi, I would understand.
Oh, yeah, I got an English chat.
No, I don't. I don't think there were microchips and all that like crazy stuff. In fact, I think
Why not?
the attack that there's no evidence.
Yeah, but I mean, there's not any evidence that they're using this to save money. But in the same way, you could describe a plausible incentive for them to kill people on MAID to save money. I'm not saying it's happening, but it's plausible. You could say, yeah, it's plausible that there's an incentive for them to put microchips in us to, release certain chemicals or to have us do something. So, like, why is the lack of evidence in the microchips example make it so much more crazy than the, hey, they're killing people with MAID to save money?
Lack of maybe it's just a general distrust of government, and just I'm being candid. That's kind of where I would lean. It just seems really, really suspicious at that time that we would implement or that we would commission a study. It just seems unusual. I guess that would be kind of the way that I would look at it. It's unusual.
No, I get it. But
now that
hey,
we kind of see these instances.
Did you know there was a CIA paper, we just had this declassified recently, that explored the idea of population control through vaccines, maybe by hormone or certain chemical imbalances or changes in the endocrine system. And we had, isn't it unusual that we had a once-in-a-lifetime pandemic at about the time where the World Economic Forum is talking about like overpopulation and how like things are getting out of control and chaotic, and we need to find better ways to like help society. And this paper comes out, and they're saying, and now it's mandatory or heavily incentivized to get everyone to get this vaccine. Like, I could draw the same conclusion that maybe it's a microchip or maybe this is a mass control program that you seem to do, and also use your priors, which is because I just trust the government and these things happen at the same time. But you believe one and not the other is because you've seen it more? Like,
no, I did trust the government. I think Yeah, well, I think I have seen it a lot more, and I know America just looks at like Canada's the top hat of America. Whatever happens there, I don't know. They eat maple syrup and live in igloos or some shit. I don't know what you guys think, and poutine or something.
I've been there. It's all igloos.
You're not wrong. But I think maybe it is like it could be an echo chamber thing, or people that have a lot more information that are develop or that are giving out this information. I just have an inherent distrust in government and in these institutions. I don't trust them. I think that they should have extreme levels of scrutiny, almost to the point of like numbers should be exposed. We should have a lot better information. Like as you had stated, what number of people are having these things happen, or you know I would much prefer that type of information. So
I agree completely, but I want to suggest a prescription for you. Sorry to interrupt, but I don't think then you should be saying we shouldn't have socialized medicine. I think you should be heavily advocating for transparency in MAID numbers and higher investigation of this to make sure what you're describing or worried about isn't happening. Because if it is, let's say this was happening, let's say it was all true. Holy shit, I'm on your side. We cannot have a system that incentivizes the government to kill people to save money. This is just not okay. Obviously, rationing care is always going to happen. You're never like insurance. People like to shit on insurance companies, and I think a lot of it's deserved. But if you look, there's a very specific example in Michael Moore's Sicko, which everyone points to as look how evil the healthcare industry is. And there was a guy who they could have saved, and they didn't, and he died, and his wife gives this testimony. And you look at the case, and it's like, hey, the thing they were requesting was a multi-million-dollar experimental surgery or treatment that didn't even have like more than a 50% chance of working. And you can't give that to everyone. It is literally impossible. We do not have the money. We do not have the resources. So it's understandable that some degree of this is going to happen. But if you're incentivizing the government to say, well, it's not going to happen, so we're going to go down this crazy utilitarian pipeline where we just start killing even the most inconvenient people in the slightest way just to make sure that everyone else has even better marginal healthcare, yeah, that's fucking crazy, and we need to stop it. But we're not even there yet. You need to investigate it first. You need to see if it's even close to happening, and not kind of base it off of, well, I don't have any evidence, but I distrust the government, and we're kind of like, it makes sense that it could happen, right? Like, I think your prescriptions are a little 3 steps ahead.
Well, and I would push back that with so the instances that I talked about, like the Olympic skier who or the whatever the Olympian that where she just wanted a lift chair, and they said no, we're not going to do it, which I think is a minor inconvenience for a system that you are paying into. And when the government just says no, there were many articles. I know they're all anecdotes. I don't know the percentages, but when you start seeing more and more of these stories coming out, a guy had, like I said, had seasonal depression and type 1 diabetes. Or when we have people from the military that are coming back and the government says, hey, you know what, don't worry about it. We're going to take care of you. But also we're going to sue the shit out of you because of your medical expenses. And I think that this starts kind of creating a mosaic or a bit of a picture of what are they arguing? Why would they be so inclined to fight against this stuff? There was one of a chick or
before
a lady
you move on
that
to a
was
new story. Can I bring up because I just brought up the Paralympic thing, and I can I read you a quote like about this that I think is a reasonable response to if they did offer him a suicide kit. Trudeau said, "We're following up with investigations. We're changing protocols to ensure what should seem obvious to all of us. That is not the place of Veteran Affairs Canada, who are supposed to be there to support these people who stepped up to serve their country, to offer them medical assistance in dying." So it seems to be the case that if this was something that was happening more and more because they're incentivizing it, you wouldn't come out and say, hey, we're going to investigate this. We're going to make sure stuff like this doesn't happen. And we're going to try to write protocols to, have some sort of set of instructions of like what needs to be happening before you're even allowed to suggest this. Like, hey, maybe they need to be terminal, or it needs to be like less than 5% chance that you're going to live. Why would they then start trying to introduce these protections if they did want to kill more people and then get away with it?
Right. Well, I assume that you can say one thing and do another. So I think I'd have to look at some of my stats, but with regards to MAID, I think out of BC, I think 14 people died under MAID that should not have qualified. There's a doctor that I lovingly call Dr. Mangala out of BC who authorized the killing of 500 people that otherwise should not have.
Okay.
So, when I think when you start seeing these kind of trends,
is it a trend though, or is
if
it one
is
guy
making
did it 5
national story.
times? But that's the thing. The reason this stuff
Well,
makes
it's
national stories, in the same way when that person brought up Lake and Riley, is because it's insane, right? We both agree. Whoa, this guy's telling people to kill themselves that shouldn't. That's really bad. And so if you get an illegal immigrant stabbing a innocent little beautiful running white girl to death, that's fucking insane. It's going to blow up. And yet, is this a thing? Is this a trend? Is this happening in mass? Is this like, are mistakes happening left and right? That's not yet to be established. And so you can't look at the fact that there are a bunch of national news stories as the indication of a trend. What that indicates is that people are always going to sensationalize the worst possible cases. And now you need to step back and say, all right, let's look at all the data. Is this happening? And it doesn't yet seem to be the case.
Right. And I think that the more and more of these stories that are coming out, then we start to kind of we're noticing a trend.
But that's not how it works, right? Like, again, I'm not trying to be mean about it, but like, it doesn't matter how many stories come out. It could be one every week. And then at the end of the year, that would be 52 people. And then you say, okay, how many people died on MAID? And it's what, hundreds of thousands? And 52 of them shouldn't have? Well, that might be one guy did this once a week and we need to get rid of that guy. Or, hey, every single person who did this wrong skipped step 7 of the protocol that was already established. So these people need to be fired. That's not, hey, MAID needs to leave. That's not a trend. That's something's happening and we need to analyze it. It doesn't matter how many stories there are. It matters the statistic, right? And how many of them are happening and why they're happening and how bad it is.
No, and I would agree with that, but I would look at where are we seeing these go? Where I more look at the news, because in the United States, you guys more or less have independent media, while in Canada we really don't. So our government is really like literally the mouthpiece of the government.
You have JJ McCullough, he's independent media. I know what you're saying. A lot of it is government funded, right?
Well, and so where we see what the media does is it will kind of put out a story, and we almost kind of like gauge reaction, and it almost seems like that's kind of where the national conversation, or at least the government, where they're looking at moving. So during COVID, the media had floated out. I don't have the article in front of me, but they had floated out that if you have vaccine hesitancy and if you get anxiety, you might qualify for MAID. That was articles that were being published. And
I'm skeptical, but you proved me wrong the other time. So maybe these are real and as big, but Jesus Christ, just kill the unvaccinated is essentially the conclusion of that. So, English is back, by the way, guys. English has never been more back.
We you know what? We conquered the Spanish once again, okay? And we have taken back our rightful lands as English speakers.
Take that L, or as the Spanish say, L.
Teco dado elo. Okay. That's my extent of my.
Wisa free. I want to see Wisa freeze in the chat.
Come out,
Okay, let me read some of the super chats that are pouring in.
Well, hold on. He was finishing.
$5 for my listening library.
Wait. He was saying something about the articles real quick. Tyler. Oh, are you?
Oh, no.
Oh, sorry.
Come back for your article. Go say your article thing.
Oh, did you pull it up or?
No.
Say your article thing. No.
Yeah. Say your last point.
Oh, sorry. And so, when we see that trend, and now there's already a discussion that's happening now, should we expand MAID to babies that are chronically in pain? Should we take that compassionate line? And now,
should we?
Are you starting to understand where we're going? Hey, this is Dr. Mangala stuff.
Wait.
Because you might feel bad.
If a baby is fatally ill and it's in pain every day, should we not?
Fatally. I really struggle with once you start targeting babies.
So just to real quick, for maids in Canada, they passed a law recently I forget how many years ago it was, that non-fatal illnesses such as mental illnesses also would qualify for maids.
Hmm.
So the question that you would be asked is like, what about an 8-year-old
Hmm.
who has a non-fatal disease that is messing with their head, right? The quality of life isn't expected to be a lot. Should they qualify for maids?
Yeah, that's something I would be definitely
No.
a lot more not okay with. If it's like, yeah, your 8-year-old has Down syndrome, can you kill him? And it's like, that's what abortion's for, buddy. Come on, you had your chance.
Yeah, the Swedes dealt with that problem right quick.
Oh, did they say you can't abort?
They eliminated Down syndrome.
Oh, because they had eliminated
They
every Down
eliminated.
syndrome baby. Yeah,
Yes.
jeez. But yeah, no, I
I
agree.
laugh just.
I made a joke and I'm jabbing, but like unironically, like when it comes to mental illness, if they're already alive, it's like, yeah, I don't really like. There's arguments if you're a vegetableized hospital person, like what's the Terry Schiavo sort of situation, but it's very different. Of like, oh, you're schizophrenic, or oh, you have depression, and I think that's not something I want the government dictating whether or not you qualify. I think that could get dangerous really fast.
Yeah.
And it sounds like Canada's moving in that direction. So again, this would call for more investigation and more numbers. And if you could show me a breakdown of like, hey, we're doing this a lot more than we should, rather than just like a trend in news articles, but a trend in raw numbers, I'd say, yeah, this is not good. And they need to reconsider what the criteria for this is. Also, JJ wants to know if you
Right.
talked about
Well,
the Supreme
and
Court, which
so
I have nothing. I know nothing. I didn't even know Canada had a Supreme Court unless he's talking about the American one. So,
I don't know what he's in reference to.
yeah, JJ, how inarticulate
Like if
of
I
you.
talked about the Supreme. Yeah, you
just
BC fuck.
Does he
yeah.
want to jump in real quick
I
instead
don't
of
know if
just
he likes
talking
this sort of
through?
panels, but he's listening. So if he hears that, he'll try to
Okay.
hop on Discord. I'm sure if he can figure out how to fucking turn on a computer.
I mean, he keeps
Yeah,
just
boomer.
texting you stuff to say, and
Yeah,
that
so he's
seems
watching.
inefficient.
It's inefficient because he's not
You know,
using super
it is. I
chats.
will say your
True.
impersonation of JJ was pretty close, but you didn't say a boot.
That's what everyone's criticism is I can't bring myself to be that
Yeah.
Canadian. Sorry, friends.
But the moving on the bouncy ball and yeah.
I mean,
that
I was
good.
in his
Good.
house
I like that.
with his clothes on his bouncy ball, so I got as close as I possibly could have. But thank you, yeah.
You got as close
Okay.
to JJ without being him.
let's
Yes.
let's move on a little bit, right? Because we are kind of circling the drain just a smidge here. I guess I'd ask this to Soy Pill first,
Yeah.
right? In the American system,
Hmm.
what do you think is the most important thing that we need to change to make it better for people so that they have more of whatever you think makes healthcare better? Can you kind of
Yeah,
articulate that? And then I'm
I
going to
think
ask the same question
I
to
mean, this is not going to
uh,
be like a in-depth, point plan. People have laid this out.
sure,
Bernie
sure.
Sanders has, and other people have. But I just think we need a public option. The fact that there is not a public option that everyone always has access to, and we're spending all this money on all this healthcare and not getting the intended outcomes, I think is indicative that we could be taxing more and spending less based on these, analyses, both from the left and right. I think was it Cato or Heritage who had a similar analysis to the one Bernie had put out, and it's like, yeah, it just seems to me that there should never be someone who doesn't go to the hospital because they can't afford it, or even not because they can't afford it, but because they perceive that they can't. That should never cross anyone's mind. Obviously, things could still happen, like he said in Canada, but I just need more money to be taken from people and put into healthcare. I know that sounds evil and draconian that we're going to do that because the way I phrased it, but yeah. Oh, and JJ said he's going to try to come in, so let me send him an invite.
Send him the link, tell him to accept the rules, and we'll see what we can. But just though to kind of one of the criticisms I hear about these things, like uh, having more government subsidies for medicine and things like that, is it disincentivizes, and especially caps on medical costs. That it disincentivizes research companies and pharmaceutical companies from developing new drugs that would save lives. Um, One of the biggest benefits that we do have from America's private healthcare system is our R&D.
Mhm.
We develop new treatments, new drugs, new ways to fix people that just doesn't happen in other countries. And I guess the question for me to you, Soy Pill, is
Mhm.
like, are you willing to give that up in order to treat the people we have now?
So two things. There's one argument is, yeah, if this was a dichotomy, we can only pick one. I would say, yeah, if I could choose to make more people healthy today to give up the potential for future people to be healthier because we found the cure to cancer faster, I would. I really would. I think on like unless there was like a obviously you can get at the minutia and I'd have to do some calculus and number crunching, but for the most part, I'd rather not be like, oh, sorry, we're gonna let a bunch more people that need to die and suffer today because in the future this might reduce the suffering of people that haven't been born yet or people once they're 80 who are 20 today. I do think that I would give that up. Now I don't think you have to. I don't think you have to give up R&D completely. I think you can spend a lot on healthcare and you can still subsidize the R&D. I think negotiating drug prices is something where like, oh, this healthcare cost and R&D cost stuff is going to fuck over innovation and incentive for innovation. So potentially you can work out something there. That doesn't mean you have to get rid of socialized medicine. It just means, hey, we got to be careful about the way that we're changing incentive structures for private companies who do research. So I don't think they're mutually exclusive. But if they were, I think I still would pick the less suffering today instead of future suffering. JJ said send it again. Give me a second, but he is trying.
Yeah, take your time. To Tyler, I guess the same question to you initially is, out of Canada's system, how would you fix the wait time issue that's going on over there?
I think you need to incentivize people's greed. I think that's it.
Can you be a little more like how?
Yeah.
I guess.
Yeah. Doctors should be paid for their work, compensated well for it. As we see with many doctors who have left Canada, they go to the United States because they can actually make a good living there. And our healthcare suffers specifically because of that, and because we have to import. We literally import doctors. In fact, we were losing, like I said, I think it was 1,300 doctors a year. We've only now stabilized because we're actually importing doctors. That's the only way our healthcare system even functions, is we have to import people.
So immigration good? Okay. No,
no.
how is this a socialized problem is my question, right? Like, how is socialism in your healthcare system causing this issue, right?
I think because it tries to remake the noble doctor as they're doing it out of goodwill, rather than I want to do it to save people, but I want to make a fat check at the end of it. So that is one thing that that the United States is very good at incentivizing, is people's greed, their want and desire, rather than, you're doing it out of the kindness of your heart.
It says that
Hopefully
JJ has to be in for 10
added-
minutes before he's allowed to jump
No,
backstage.
I gave him a role. He
Okay.
figured it out.
All
I'll
good.
pull him in and see what he has to say.
What is this? Are we really going to listen to a Canadian? I don't know how I feel about that.
I don't look. There's two of them
I am a
now.
Canadian. What the fuck?
I know. That was the joke. Oh, he's on one of his famous JJ walks.
Hey guys, thanks for including me.
Well, you were
Can
you were sounding off in chat, and I figured why do that when you
I was yeah, thank you. Sorry, I think I've never done this before, so this is quite a thrill. No, I think that when we talk, like when Tyler talks about the maid and all of that, I'm sorry to bring it back to this conversation, but I think, Tyler's sort of fundamental conspiratorial view of this, I think, is just really kind of misdirecting the conversation in a very fundamental way. Because it's important to understand that the core reason why MAID exists in Canada is because the Supreme Court of Canada has ruled that Canadian citizens have a right to end their own lives. The Supreme Court of Canada has ruled that this is a constitutional right, and that the government therefore has to create a structure in which the exercise of that right can be pursued. And this has actually created a lot of trouble for the Canadian government, and this is why, the laws have to keep being updated, and they have to keep making exceptions and allowing more and more people the permission structure to, end their lives. Because when you have a constitutional right, like if the court rules that the right to end your own life is a fundamental right, then there's only so much limitation that you can put on that right before it starts being unconstitutional. And we know this because we know that in the past, the Canadian government has attempted to put all these stipulations, and it's like, oh, only if the death is like imminent, if it's foreseeable, only if it's terminal. And then there's been other court rulings that have sort of said like, no, you're restricting the right too much. So this is like just a real core fact of the situation that I think has to be acknowledged before we start going down this rabbit hole. It's like, oh, the government is trying to kill us to save money and so forth. It's like, no, the government is trying to play catch up with court rulings involving constitutional rights.
Well, I guess I wouldn't look at my worldview as coming through a court. So I would morally or ethically view as if someone otherwise is considered healthy, and as I touched on earlier, that they've looked at anxiety, people with anxiety, that they should be offered it. I'm not going to accept a government's ruling just because government said it's okay. I ethically.
I know, but you're
Go
you're making an allegation, right? You're making an allegation of government motive as to why this program exists. And what I'm saying is that when we actually look at why this program exists, it's fundamentally because the government's hands are in some ways tied. Like the government is required by courts to uphold a constitutional right in the same way that, like in America, like Roe v. Wade established abortion as a constitutional right. The Supreme Court of Canada has ruled that being able to end your own life is a constitutional right. And there's only so much limitation a government can do. And what I'm saying is that you're kind of making this allegation that the reason this program exists in Canada is because the government just wants to kill people to save money or whatnot. And that's just factually incorrect. That's not the
JJ,
history of this program.
Who appointed the Supreme Court?
Yes. Different prime ministers over the course of different administrations.
The government?
Well, just on a more serious note, though,
the government,
right?
yeah.
Like these are the allegations that a lot of people have made about the Trump administration, right? That they have appointed yes men to the court in order to rule certain ways, such as on the Dobbs issue, right? Roe versus Wade.
Yeah.
They were appointed in order to overturn this, right? That was one of the litmus tests that the right has used. So, I mean,
Yeah.
I guess it's not something I don't think we can hand wave away, that accusation, can we?
Well, yeah, you can if you're making the allegation that this is being done for like a very sort of like narrow bean counting kind of motive, right? Like if the allegation is that the government is just trying to, cut costs because this socialized healthcare system is such a, unsustainable behemoth, which by the way, I agree it is. Like healthcare spending is out of control in this country. And I'm actually pretty critical of the Canadian system in a lot of ways. I favor like a two-tier system, not a single payer system. But, Tyler is just making a very specific allegation that I just think the facts do not match. And that's why I was sort of puppeteering my opinion through Neil's earlier, right? Like we know that the government of Canada brags about increasing funding to healthcare. Like this is like a big applause line to say like, look at all the more spending that we are doing in healthcare. And it's other things that get cut in order to, steer more money to healthcare. So I just think like it's not accurate to sort of say that this is kind of like the core problem with MAID is that it's sort of being driven by a kind of fiscal responsibility, which frankly I think we've seen in pretty small supply in Canada recently.
Right. So, well, okay. So even if that is the case, I think there is that moral and ethical position that, like, okay,
And that's
what
fine.
line?
Yeah,
that's fine.
That's a different question.
Like argue argue the morality of it, right? Like you don't because I know I can sense that like you have a sort of ideological worldview, as you sort of said, like, well, I just trust the government fundamentally, and that's fine. But it's like you can't make specific claims of government motive. You can't make specific claims of government motive if the facts are not on your side to allege that motive. You can argue about it in morals terms, and like I think that morally it's suspect in some ways, and I think that the Supreme Court made an error in reading a right to death into the Constitution's promise of, life, liberty, and security of the person, right? I think that was a moral failing on our Supreme Court. But, that's where we are now. You have this constitutionally guaranteed right, and the government has an obligation to make that right accessible in the same way that prior to Dobbs, the American government had an obligation to make the right to abortion accessible.
Yeah, and I think that that's a fair position to take. I don't know. I inherently just have a value of life, and like I expound it. So,
but to the question at hand, do you have any specific evidence that you can point us to showcase maybe there are people within the government who are directing this in the way you suggest, or is it just vibes?
Yeah, actually, Tyler, to the earlier
well,
point, let me clarify this too. If you could look and you can see that some of the judges picked by Trump are approved through think tanks, specifically directed because of certain policies that they'll have that they know they'll vote on. There is like a very clear A to B to C line that you can show. Oh, the reason these people were picked are because they're suggested by these amount of people for these policies, and that's how they get through the process. And if you could show this, this could be the case that, hey, turns out the prime ministers that elected this Supreme Court had them suggested by people who wanted to save costs on healthcare. That would be more towards that evidence, right? I'm not saying this exists, but like if something like that was established, that then you couldn't say, we have a compromised Supreme Court in America that's always going to vote for Trump, like, because you can't just say that just because he picked them, they are beholden to them, they vote against him. But if you can show that the policies, the reason they were picked are certain policies that were tried, like they knew this was going to come up, that would be something that you could use to say, well, maybe the government is incentivizing MAID, right? Like you would need to show this.
right, and I know JJ is a lot more knowledgeable in the like the politic kind of the nitty gritty stuff. So I would defer to him if he said like, well, these judges they whatever work through these policies or they work through these
Yeah,
these
JJ,
institutes
explain
that
this
advocate for
conspiracy
these
to me.
positions. So
Well, I'm just saying, Tyler, with all due respect, like, if you want to have a sort of substantial debate on this, you do have to have a little bit of background in the topic at hand and the history of it. And, it's not just me being some Canadian politics nerd who likes the nitty gritty, right? It's like, I've been following this story. I've been reading the coverage of it. I've been tracking how this has come up and come to be, right? And so as a result, like, the facts are the facts. And otherwise you're just kind of like vibing it out, as Niels has said, right? Like, otherwise you're just kind of like making inferences based on what, plausibly feels like it might be true. And like, that might work if you're in like some academic philosophy debate. But when you're having like a real world debate about actual real world policy in a real world country implemented by a real world government, I just kind of feel like it behooves you a little bit to be a little bit more grounded in the actual facts of the situation rather than just kind of, drifting into conspiracies about what seems like it might be the case.
Tyler, he's calling me out too because I didn't know about this.
I know, like, what the. I thought Canadians are supposed to have each other's back, but all right, I got it. It's all right.
I'm still not
it's
convinced
because, like,
Canada is a real place, frankly.
I'm critical of it. Like, there's a lot of things to be critical about in the Canadian healthcare system, and it's like, and I've made a whole video about like problems with Canada's sort of socialized medical model, which I do think has significant failings, and I think there's important lessons for Americans to learn from it. But I just kind of feel like this particular line of reasoning is not a very persuasive one at all, and I think can be easily swatted down.
Well, let me ask you a question. Wait, I want to ask him a question. I have a question for JJ. As an Ameriboo, the Ameriboo that he is, is the Canadian and to most extent single-payer system an argument against socialized medicine, or just an indication of the shortfalls of how the Canadian government has handled it, and America can learn from its shortcomings and still adopt something better?
Yeah. I mean, so an argument that you often hear in Canada from people that are critical of the Canadian sort of status quo is that Canada and the US are like two extremes that is really quite unprecedented elsewhere in the Western world, right? So it's like in Canada, you have basically like a Medicare for all single payer type regime in which there are prohibitions on the pursuit of public health insurance and health clinics beyond what the government will allow. And that's like a very, very extreme end of the spectrum. Whereas then in the US, like, you do have Medicare and Medicaid and this kind of stuff, but, the eligibility for it is very limited and controlled, and you have to be over a certain age and so on and so forth, right? And that's very extreme as well. And so the conclusion that sort of critics of the Canadian system generally reach is that Canada should have what they have in so many other Western countries, which is a two-tier system. So you have a Medicare for all system for people that need it, and it's accessible for anybody that needs it, but there are no prohibitions on the pursuit of private insurance and private clinics and private operations, private hospitals and so forth, if people want to pursue that as well. So I think like, this is why I'm critical of, like the Bernie kind of plan, the Medicare for all, which I think openly covets the idea of just getting rid of private health insurance and getting rid of like for-profit hospitals and so forth in the US, I think that's the wrong approach. And I think Canada, the dysfunctions of the Canadian system are in some ways a lesson of what happens when you try to eliminate private insurance and private clinics and so forth, and private hospitals and private doctors and all that.
Not to start debating you, but how do you make sure that in a two-tier system, the private system and its benefits don't undermine the healthcare that everyone else have and actually make it worse? I know that's a broad question and that you can't just prescribe the exact solution, but like I know that's a worry as well.
Well, I mean, and as well, Niels, I feel like now you're kind of getting into the same situation that I was criticizing Tyler for, where you're just kind of like, you're arguing on the basis of what feels like it could happen rather than, necessarily any evidence that we have that it will happen. And I just think what I would say is that when you look at other countries, when you look at what they have in Sweden or France or Germany or wherever, right, like that they generally make this two-tier system work. And, I'm not an expert on those systems, but, the status quo is generally pretty popular in those places. They're not advocating for a Canadian style model. Like the Canadian style model is not popular, right? Most countries make peace with some sort of two-tier system. And that would suggest to me, at least, that sort of the doomsday scenario that you're describing doesn't actually happen in practice when such a system is implemented. And again, like, I don't know exactly why, but I don't know. I guess maybe just the incentives aren't there, but yeah, you would have to sort of look at other systems. I think that actually the American debate on this is sometimes kind of warped by Canada being the country that, most Americans are most familiar with. But I think that both Canadians and Americans, when we're debating healthcare, we should look beyond, these kind of two extremes. Either everything is done by private insurance or everything is done by government insurance. And there's nothing,
well, then
sort of
final question, short answer: Canada or America? If you had to live in one for your healthcare needs.
That's a very hard question to ask, because it does depend a lot on like how much, like not just how much money you have, but like, what's your situation with your employer? Do you have access to good insurance through the job that you have in the US?
You wake up tomorrow as the average citizen in either country. Which would you rather?
The average citizen in either country. A veil of ignorance. That's a good question. You really sort of put me on the spot.
You don't know. You don't know where you're going to be.
You don't know if you're going to be sick. Yeah, you have no idea.
I mean, I guess you would have to say you'd rather be the Canadian in that situation, just because I suppose there are scenarios where you wouldn't want to be like a poor. Well, but that's I don't know, because like if you're a poor uninsured American, you can get Medicaid, right? So you would have to sort of assume that like Medicaid is worse than the Canadian system, and I'm not super sure if that argument would really track.
I've turned this into JJ debates himself stream. I like this.
So I mean, it's like both Canada and America generally, like this is the other thing too as well. And I don't mean to like, dodge, because it's a good question. It's a provocative question. But it's like when you look at international studies of healthcare systems around the world, Canada and the US generally rank very low. Like our two countries are like at the bottom of the pile in terms of international rankings of,
Who's the best? Who's top?
It's usually
best
France.
is like just the other. Yeah, it's usually the countries that you'd expect, the wealthy Western European democracies, right? Like they're doing it best.
JJ,
and Canada and the US with our
this.
extreme systems are doing worse.
I need to supplement this though. If you ask experts to rank, like the fourth most healthcare experts, they usually don't all say the same thing. In fact, the answer that they almost all of them give, because they're incredibly intelligent, is it depends. It depends on who you are. It depends on how much money you want to spend. It depends on if it's like, is it single payer? Is it is the social healthcare as in like government run hospitals, or is it government run insurance like it is in Germany, right? Like these are all things that they take into account, and not a single one of them is considered like the best. There are just much better outcomes on average for average people, which is why I asked the average citizen. Also, it looks like I'm on a green screen right now, so I'm not everyone. I'm real.
Are you guys able to hear me clearly? By the way, I know it's kind of a bit of a windy day. Hopefully, that's not causing too many audible problems.
Just fine. Thank you.
It's fine, but I swear to God, if a fucking Vancouver citizen walks up to you and is like, "Oh my God, are you JJ McCullough?" I'm gonna blow my brains out on stream.
No, but what you're saying is true, right? Like there are a lot of
for a druggie to come up to him, ask him for money.
Ooh, that's not in that part of town yet.
I'm in the West End, so things are pretty good here, so I wouldn't worry about that. But But no, I mean, like you make a good point, Neil. It's like there are so many variables in terms of what you're measuring, who you're talking about, like what part of the country you live in. I mean, in Canada, we know, for example, that there's huge disparities between whether you live in a like rural area, which we have a lot of in this country, or if you live in a big urban center, you know, like what particular city you live in. Like there's a lot of limited resources and all that kind of stuff. And then, yeah, and then like quality of care, timeliness of service, you know, like there's just like the availability of specialists. Like there's just so many different things that you can base this on. I mean, I think at the same time, it's important to realize that, you know, like neither Canadians or the Americans are living in like a dystopian society when it comes to healthcare. All things considered, you know, most of us are healthy. Most of us can get access to the quality of care that we want or need. You know, most of us are not dying in the streets or dying on waiting lists or going bankrupt. Like these are the extreme cases. We can obviously do better. And I think in order to do better, we need to look beyond this continent and look at some examples on other countries.
Fair enough.
All
Well,
I
okay,
heard
thank you for
was
calling
we
in,
should
dude.
All right.
made JJ. Put him down, folks. Canada needs to put down JJ.
All right. You guys have been very generous with your time. I appreciate you including me in this conversation, but I'll let you guys go now. I did not mean to hijack your little chat.
No,
It was
we're fine. We're
a
wrapping up
pleasure,
anyway.
as
So thank
always.
you.
All right.
Always a pleasure. Yeah.
Thanks so much, guys. All right. Have fun. See ya.
I already talked with JJ last night. I'm having far too much JJ. Too much JJ.
No, he kept using your name, and that threw me off. Okay.
That's fine. That's public.
Okay, I was just like, should I stop him? Do I draw attention to it?
No. JJ knows. It's fine. My name's Niels. Everyone knows that.
Fair enough.
In fact, you should call me that
Anyway,
more when we're in
our
private
little
chat.
okay, our tete is over, and we're going to close off with some closing statements and kind of give some, again, closing arguments about why we think socialized healthcare is a net good or a net negative.
Yep.
I want to thank you both for coming. This has been interesting, at least to me. I know we had some tech issues with the YouTube chats going El Spano the whole time. It was wild and distracted me, and yeah. But I want to give the mic first to Soy Pill, and I want to let Tyler have the last word. Remember to tell people where they can find you. I have links to both of your things in my YouTube chat description. So go ahead.
I kind of
Soy Pill
said
first,
all of it
and then
already. I even kind of said it in the same way, but essentially I see better outcomes happening all over the world, and we, I think, can achieve this. I think we spend way more than we need to. I think people die way before they should. I think Tyler has raised potential possible complications and real quantifiable complications like wait times and dying from wait times as things that could go wrong with this. But I don't think this should stop us from getting a better healthcare system. I think socialized healthcare in general, or promising some sort of baseline care to every citizen, is, in my opinion, not just a necessity in terms of letting people live longer, but just a moral requirement for living in a society. And the fact that people die without healthcare is insane, and we're always going to be improving this no matter how many shortfalls are there. The MAID stuff, I think, is a little adjacent. Maybe there are reasons against MAID, but not in social healthcare in general. Otherwise, Tyler, this has been incredibly respectful and good faith. One of the most pleasant conversation debates I've had in quite a long time, especially considering my roommates get mad when I yell. Good thing I'm on the road now, but I really hoped that this one would get really mad and mean and contentious, because this is like the one opportunity when I'm not home and I have the opportunity to yell. But whatever, it's fine. I had a good time. So thank you, and thanks to JJ coming on. Thanks, Wick.
Oh, thanks for being here. And if you want to yell, I can maybe see if Mantis is off work, get her in, and tell she can tell us why your chat is the worst of the worst. That was fun.
Well,
anyway,
she can't Twitter stalk me anymore because I'm banned.
True. Tyler, close us out.
Yeah, so I think with looking at the extreme form that socialized healthcare has been, and when you put government in absolute control of your health and the certain incentives that Canada has instituted, I think major reforms and the utopia that Americans seem to have for socialized healthcare. I hope that with our discussion, I was able to, if not inform, or at the very least, if not inform and assuage some of those misconceptions, maybe kind of put them into perspective of what's actually what a socialized healthcare could potentially fall into. Yeah, no, this was great, and Soy Pill, I was watching a lot of your debates, and I'm sorry I'm not Andrew Wilson and gonna
Oh my God, thank
meta
God.
ethic or fucking whatever. I think actually having a good faith on conversation and not getting bogged down in descriptions and definitions, I think was quite fruitful, and I appreciate the candid conversation. And Wick, and again, I appreciate you taking the time to put this together. It was a lot of fun, so I appreciate it.
Glad you guys
You
enjoyed.
could
Okay,
find
thanks.
us.
Finish.
Sorry,
Yes.
I was. You could find us every Monday and Wednesday at 8 o'clock. So in about 10 minutes, my wife will be live on our show, and Saturdays at 1 o'clock. Yeah, on YouTube, Rumble, X. I think our name's the same place everywhere. So sorry, Soy Pill. Fuck your Twitter.
Wow. Okay, well, thank you for being here. Check him out, gang. Link to his Rumbles in my YouTube description. Gang, if you liked what you saw, hit that like button, hit that subscribe button. The only show we have coming up next is on Saturday, and I am going to be going to Washington, D.C., to the Washington Mall. I'm going to be live streaming the March for Democracy protest. So it's something different. It's something new, and I'm trying it out. I got all this. I got a gimbal. I got all this equipment for it. So please tune in Saturday. I want to say probably around noon. We're probably going to start.
If you have
there.
ever wanted to lick Wick's forehead, now is the best opportunity to do this.
They're gonna be finding me in the crowd. It's like Where's Waldo, only gray hoodie instead of the striped sweater. But thank you for being here, gang. I love you both.
Are you doing Collins? I see, because I see
Thank you.
non-fawn, and I feel like he wants to yell at me, and I have to go to the bathroom. But I have 5 minutes if he wants.
Do you want to do Collins?
If you want to, I want to bring non-fawn on for 5 minutes. Give me a sec, though. I'm gonna go to the restroom. Okay.
Non-fawn specifically? Yeah. Okay. Non-fawn.
Yeah, what's up?
Specifically. Okay.
Oh my God, Soy Pill's gone.
Special
Damn.
privilege.
Okay, well I have
Drew is gone from your appearance, but go ahead.
Yeah, good. Okay, I do. I have more issues with Soy Pill. Okay, but I don't watch all of the debate. I'll say for Tyler, my understanding of the baby made thing is one, it hasn't been done yet. It's only been like proposed, and two, it's it's relatively common practice in most developed countries, including the U.S., to allow parents the option to like withdraw their babies from life support when they have a lot of these illnesses or whatever that are severe. So the thing that they're doing with MAID is essentially for children who like have similar conditions, the same or similar, but don't necessarily need the same type of like life saving care, like life support stuff. They're just allowing the parents to essentially, MAID, euthanize that baby, which I can understand having objections to. I think it's reasonable to have that opinion, but I don't think it's like substantially different than what is already common practice. It's just a difference between a syringe of morphine or whatever and withdrawing life support. I don't see a big difference there.
Well, I think where the discussion had, in fact, one of our like kind of longtime guests, when we had brought this up, one of the issues was cerebral palsy, and he said that if this was available, what if my parents killed me? I wouldn't have been alive. And even with the discussion, we had like touched on with regards to depression, then possibly my wife would be dead. So.
Sure, and I can understand having
concern.
the objection to it based on that. I'm just simply saying, there are a lot of children who otherwise would have been alive, but their parents had the option to withdraw the life support when they were babies. I get it. It's a difference between withdrawing life support and like actively killing. That's the big difference. It's not like some crazy new program. And this is like relatively like this happens in the U.S. with our private healthcare system as well.
Right, and I think that's like. Almost kind of like getting into the trolley problem. Like, do you just let the person suffer? Or are you actively killing the person by pulling the plug? Like, and I think when we really have to look at like, do we actually value life? Do we value human life? And should we do everything possible in order to maintain that life, or is it just some life? Fuck it. It's just not worth it.
Well, I was simply pointing out. I think it's reasonable to have either opinion there. but like people act like it's this like crazy, insane thing or whatever. But it's already, pretty or something similar, very similar, is pretty common practice in most developed countries where we allow parents to withdraw life-saving support from these children.
Well, and I think that gets
but-
into a deeper discussion of like
Yeah.
just
I agree,
because law says it's okay.
honestly,
like,
I
we
think
don't
you're
have
being
to get
hyperbolic
into
about it.
you know.
But
Yeah, real quick,
Yeah.
Yeah,
Nonfon, I have a couple minutes.
I know that,
Did you have something to yell at me? I know you yelled at me for talking about drug prices.
Real quick.
okay, listen, I love you, so Phil. Okay, that's why I'm going to give you better arguments. All right, I obviously, okay, future people matter. Maybe they matter a little bit less than current people. Okay, I don't think that.
I think they matter way less.
reasonable
That's why I'm okay
position.
with abortion. I
But-
don't care about human potential life. I care about human life.
But I think, okay, so I would just say, like, one of the reasons working on climate change is good is because it makes future human lives happier, right?
Well,
Like,
no, it's because if not,
that
then
is- that
humanity
is at
will
least in the
potentially go
basket of reasons.
extinct. It's about extinction. If the R&D for this stuff was, hey, we need this R&D because there's going to be a hyper antibiotic resistant, mushroom fungus that's going to kill all of us, then I'd say fuck the people now, get all the money into that right now. But that's not the case. It's, hey, people will live longer, certain diseases will be cured, right?
I don't think you would hold, if 80% of humans were going to die to climate change instead of 100%, or if it was even 50%, right? The human population
but how many
would
people are
be
going
reduced by
to
like 50%
survive?
in the
What's the
future.
quantifiable between the future people that will live longer because of R&D drugs and
Well then, current people live 10 years less, but 50% of people in the future don't die of climate change.
wait, current people die 10 years
They have
earlier,
less life
but we
expectancy,
cut
are less
the
healthy,
we cut the millions of
they
like
die at
climate
a-
deaths in half.
Yeah.
Yeah, no, 100% I'd be okay with that. I would say, yeah, if we had to be like, all right, we're getting rid of a lot of luxuries because these things cause incredible climate issues and people are going to die at like 80 instead of 90, yeah, I'd be on board 100%.
So would you be okay if we had a little less luxury healthcare for people? Maybe they die of a few preventable diseases that they otherwise wouldn't, but in the future, some of these diseases just be cured.
It depends on how many more people are surviving because of this. And right now, I think the problem is you're talking about. That's the problem. We don't know, and it's like
we
R&D.
do have estimates, but
we have estimates, and R&D is I'm going to try like 400,000 drugs and one will work, and that one working is the like, hey, this is the one that saves me, right? This is the one that saves my company, excuse me. And so we can't just say, well, what are we going to be curing next? There are incentives, of course, to do a lot of different things: curing cancer, extending life, getting boners. Like these are all things that like the medical industry is incentivized to build. But I don't think that we should. It's not a dichotomy of getting rid of all of them and getting rid of none of them, and it's also not a dichotomy of if we do have to pay these things less or disincentivize it a little, does that mean we can make people suffer a lot less? And I think really the trade-off is how much more healthcare can we get right now and still be able to negotiate drug prices in such a way that doesn't make it so we've turned off any incentive to build a drug, which I don't think is the necessity in order to end current suffering that doesn't need to happen.
Sure. I mean, I think whether or not the trade-off is worth it is going to depend on what estimates you find the most accurate or think are most accurate, and it's going to depend on how much exactly you discount kind of future people. Okay, but the better arguments are, okay, I'm sending you 2 studies. Okay, and like one of the authors of the study has like a few different papers on this topic. Both of them are essentially saying they're like, oh, it seems like most of the reduction in innovation, at least in the short term, resulting from like price controls and stuff, is like a non-novel medication that probably has not like crazy positive welfare effects. And I think one of them specifically, I think, looks at a lot of them are like in old age care things, which you wouldn't, that might make the lives of old people better, but it's not necessarily like having a substantial effect on life
people. I agree with.
So those are your exactly.
No, this is good. I will bring
okay,
these up.
Okay. Yeah, non-fun. Thanks for calling in. I do got to go though, so I'm gonna end. Also, I don't know if JJ is pro-maids or anti-maids. I can't tell. But if he's pro-maids, Eucharist would love to debate him at some point.
Okay. JJ doesn't debate. He just sort of talks eloquently, and then, it goes on from there. And he says, well, that's how it goes. Something like that.
Well, Eucharist is a pretty good faith guy, so I figured if he's gonna dip his toes in, Eucharist is probably the guy to start with. But anyway,
sounds good.
I love you guys. I'm gonna end the show, and I'll see you guys later.
Wick.
Okay?
Thank you very much.
Bye, Tyler. Thanks for tuning in, guys. That was fun. Let me just double check. I didn't change. Miss any super chats. I do see the Wisa free. Thank you, Rick Bean. I saw a couple of people joined. Rick Bean became, oh no, that was last night. Irvine became a member. So thank you for that. And that might be it, guys. Same updates as yesterday. If you were there, I am working on the video while I am away from home, which is possible thanks to this laptop that won't turn on sometimes. God damn it. But trying to get it out by Friday. If it's not, it's going to be like first couple days of March. They keep releasing Epstein stuff. That's why I have to keep changing it. It's annoying as fuck, but I do have more help this time. Otherwise, type 1 to end the deep state. Hope you guys have a good weekend. Stay safe. Eat your vegetables.